So hello students. Just one moment. Okay. So hello students and welcome to the FMG Predictor Series. Hi. FMG Predictor Series. Hi. One moment. I'm not able to see your chat. Just one moment. Okay. Hi. We'll start. Hi, Dr. Ayappa. So let us begin. Let us begin with the first MCQ. Okay. I'm Dr. Pradeep Pawar, Professor of Anatomy at PW Meded. Okay. So we'll be discussing 50 MCQs. Try to be interactive. Try to answer whatever you can. Let it be an interactive discussion. So when we discuss one MCQ, the four options will help you to understand many other things also. Okay, let us begin. So failure of development of the third pharyngeal pouch would most likely result in the absence of which of the following structures? Yes. What do you say? So answer is parathyroid gland and thymus, right? So endodermal pouches, if we see the endodermal pouches quickly, go through this. These are the ectodermal clefts here. These are the endodermal pouches here. Same here, endodermal pouches, the ectodermal clefts here. And now we join this. This becomes one pharyngeal arch, second, third, fourth, and sixth pharyngeal arches, right? So what is the first endodermal pouch form? The first endodermal pouch forms it divides into two, a dorsal and ventral part. The dorsal part forms a tubotympanic recess, right? And the ventral part joins with the second to form the palatine tonsil. The first pouch forms the middle ear cavity and the eustachian tube. The second forms the palatine tonsil. The third forms the thymus and the inferior parathyroids. The fourth forms the superior parathyroids, and it merges with the sixth to form the ultimobranchial body. Ultimobranchial body. So this is correct. So this is parathyroid gland and thymus. Ultimobranchial body gives rise to the parafollicular C cells of thyroid, but recently it has been shown that parafollicular C cells are derived from any guesses? Till now we used to say parafollicular C cells of thyroid are derived from ultimobranchial body, but now it has been said that the parafollicular C cells are derived from what? Any guesses? From the neural crest cells. Neural crest cells. So if you have parafollicular C cells of thyroid are derived from, your first answer is neural crest cells. If that is not in the option, the second option is going to be the ultimobranchial body. Just remember that, very important. Regarding palatine tonsil is derived from the second endodermal pouch. Second endodermal pouch. Yes, very good. Dr. Ayappa, very good. Who else is there? Aruna. Hi. Fine. So that's fine. Auditory tube and middle ear cavities derived from the first endodermal pouch. First endodermal pouch. We come to the next MCQ. Damage to the superior laryngeal nerve during thyroid surgery affects which muscle? Yes, answer this. You can answer this. Damage to the, one moment, I'll just one moment. Okay, damage to the superior laryngeal nerve during thyroid surgery. So I'll just give you this flow chart. If you can answer this flow chart, we have got the vagus. The vagus gives two main branches. One is the superior laryngeal nerve. The second one is the recurrent laryngeal nerve. Superior laryngeal nerve divides into an external laryngeal nerve and an internal laryngeal nerve. The external laryngeal nerve supplies the cricothyroid. Its motor, it supplies the cricothyroid. What is the action of cricothyroid? It's a tensor of the vocal cords. Cricothyroid is a tensor of the vocal cords. If the cricothyroid is damaged, the tensor action of the vocal cords is lost. The pitch of the voice is lost. huskiness of voice. That condition is known as huskiness of voice, right? So cricothyroid is a tensor of vocal cords. Who's an abductor of the vocal cords? The posterior cricoarytenoid. That's an abductor of the vocal cord. The internal laryngeal nerve pierces a membrane. Chalo, answer this. The internal laryngeal nerve pierces something. The internal laryngeal nerve and the superior laryngeal vessels, they pierce the thyrohyoid membrane. Okay, they pierce the thyroid membrane. This internal laryngeal nerve supplies the sensory supply of the larynx above the vocal cords. Above the vocal cords. This also includes the posterior most part of the tongue and the epiglottis. Epiglottis. The recurrent laryngeal nerve enters below the inferior constrictor, supplies all the muscles of the larynx except cricothyroid, supplies sensory supply below the vocal folds. Perfect. Be very clear about this. This is very important. So what is the structure which is pierced by internal laryngeal nerve? The thyrohyoid membrane. That's another very important MCQ. Thyroid membrane is pierced by internal laryngeal nerve and the superior laryngeal artery. Superior laryngeal vessels. So answer for this is cricothyroid. Cricothyroid. Yes, all of you have answered cricothyroid. Yes. Posterior cricoarytenoid is an abductor of vocal cord. Abductor of vocal cord. It is known as the life-saving muscle of the larynx. Cricothyroid is the tensor of the vocal cord. Can anyone tell me which is the safety muscle of the tongue? De Gorge's syndrome. Yes. Which is the safety muscle of the tongue? Any guesses? Safety muscle of the tongue is genioglossus, because it protrudes the tongue. The genioglossus protrudes the tongue to the opposite side. Safety muscle of the tongue is genioglossus. Safety muscle of the larynx is posterior cricoarytenoid. Remember that, very important. Okay, fine. So which part of the brain controls balance and coordination? That's a very easy MCQ. That's a very easy MCQ from the PYQs. Which part of the brain controls balance and coordination? Answer this, students. Answer this. Yes. Any guesses? That's the cerebellum. Cerebellum controls the balance and the coordination. And tell me which is the largest nucleus of the cerebellum? The largest nucleus of the cerebellum is... Yes, any guesses? Yes, the largest nucleus of cerebellum is a dentate nucleus. So what are around the topic we are just discussing? Yes, Kirti, very good. Yes, Ayappa. Yes, Arun, Anubhav. Aruna. So the largest nucleus of cerebellum is the dentate nucleus. Cerebellum is mainly sensory, correct? Cerebellum receives all sensory input, which is the only motor output from the cerebellum. Yes, can anyone tell me this? The only motor output from the cerebellum, what is the name of that cell? And this inhibits the deep cerebellar nucleus and the lateral vestibular nucleus. Who's that in the cerebellum? Who's the sole motor output? Come on, answer this. Which is the sole motor output from the cerebellum? The Purkinje cell. Purkinje cell. So two more MCQs I've told you about the cerebellum. Yes, two more MCQs I've told you about the cerebellum. Number one, the largest nucleus of cerebellum is dentate nucleus. Yes. And the second one is the Purkinje cell is the only motor output from the cerebellum. The cerebellum is connected to the brainstem by three connections, the three peduncles. You need to know the fibers passing through the various peduncles. Anyway, there's only one fiber passing through the middle cerebellar peduncle. Can anyone answer this? The fiber which passes through the middle cerebellar peduncle is, come on, come on. Which fibers pass through the middle cerebellar peduncle? There's only one fiber. The middle cerebellar peduncle connects the pons to the cerebellum. The fibers are pontocerebellar fibers. Only afferents, pontocerebellar fibers. Fine. Okay, fine. That's it. The rest is fine. Now, which of the following arteries forms the circle of Willis posteriorly? Yes, circle of Willis posteriorly is formed by which artery? So, if we draw the circle of Willis here, can anyone tell me? That's the internal carotid artery here. That's the internal carotid here. That's the anterior cerebral artery. That's the anterior cerebral artery. Anterior cerebral artery. That's the middle cerebral artery. This is the anterior communicating artery. Anterior communicating. From here, these are the two vertebral arteries. Vertebrals will join to form the basilar. Basilar divides into two posterior cerebral artery. What are these two arteries? Any guesses? These are the posterior communicating artery. So this becomes a circle of Willis. Circle of Willis. So answer for this is posterior cerebral artery. Can anyone tell me which is the artery not taking part in the formation of circle of Willis? Which artery doesn't take part in the formation of circle of Willis? So circle of Willis is formed by, number 1 is the anterior communicating, 2 is the anterior cerebral, 3 is the internal carotid, 4 is the posterior communicating, and 5 is the posterior cerebral artery. The artery which does not take part in the in the formation of circle of Willis is the middle cerebral artery. Very important, remember that, students. A very important MCQ. The artery which does not participate in the circle of Willis is the middle cerebral artery. Middle cerebral artery. Fine. Yes. Very good. Very good. Very good. Very good. What are you saying? Posterior cerebral artery supplies the. Now, if you can answer this, the motor area or the sensory area of the cortex is supplied by which artery? Come on, students. One MCQ from my side. The sensory or the motor area of the cortex is supplied by which artery? Come on, answer this. Sensory or the motor area of the cortex is supplied by, any guesses? Huh? Any guesses? Come on, come on, come on, students, you can answer this. The sensory or the motor area. Look, if I draw it like this, that's a cerebral, this is the central sulcus, precentral, postcentral, this is the motor area, that's a sensory area. You tell me who supplies this entire superolateral surface of the brain. This entire superolateral surface of the brain is supplied by middle cerebral artery. A small area on the superolateral surface is supplied by anterior cerebral artery. So blood supply of the motor and the sensory area, there are two arteries, just remember that. Blood supply of the motor or sensory area, it's ACA plus MCA. Remember that. It's anterior cerebral and the middle cerebral artery. And blood supply of the occipital lobe, yes, blood supply of the visual cortex, it's ACA and MCA, bacho. Remember that. It's ACA and MCA, both the arteries, right? And the blood supply to the occipital lobe, generally we say posterior cerebral artery, right? But the blood supply of the occipital lobe, again two arteries supply the occipital lobe. The occipital lobe is supplied by posterior cerebral artery plus the middle cerebral artery. The middle cerebral artery supplies the macula. Macula is an area of fine vision. So blood supply of the occipital lobe or the visual cortex is posterior cerebral plus the middle cerebral artery. The middle cerebral artery supplies the macula. So two more MCQs I've told you from my side. Understood? Enjoying, students? Okay. So just remember this. Right. Clear. So answer for that was posterior cerebral artery. That's it. Anterior and middle cerebral arteries are branches of what? Of internal carotid artery. Anterior and middle cerebral are branches of internal carotid. Out of this, which is a continuation of internal carotid, the middle cerebral artery. The middle cerebral artery is a direct continuation of internal carotid artery. So any clot, any thrombus in the internal carotid will directly go to middle cerebral artery. Middle cerebral artery. Fine. That's it. Now, this internal carotid artery lies in the carotid sheath along with the vagus nerve and the internal jugular vein. Internal jugular vein, vagus nerve, and the internal carotid artery lies in the carotid sheath. Fine, perfect. In the given image, identify the nerve. Come on, students, if you can tell me this, what is this nerve? Come on, students, come on. ACA is medial surface, yes, bache, and middle is lateral surface, but a small strip on microworld, a small strip on the supralateral surface is supplied by anterior cerebral. That is why it becomes two arteries supplying the motor and the sensory area. ठीक है बच्चे, clear है? Microworld clear? So just remember what I'm telling you. I've been teaching the FMGs, the NEET PGs since last 20 years. So everything important, I'll try to tell you. Just be there. But AC is medial surface and middle is lateral surface. But see, AC is the medial surface, that's clear. But a small strip on the lateral surface is supplied by ACA. A small strip on the supralateral surface is supplied by ACA. Okay, fine. Okay, so what is the answer for this? What is the answer for this? That's a, yes, what is this nerve? Any guesses? That's a auriculotemporal nerve. Nahi hai ye. This is the greater auricular nerve. That's a greater auricular nerve. Identify the nerve in the given image. This, no? You're talking about this nerve. This nerve is going to supply the skin over the angle of mandible. Here is the angle of mandible. Here is the angle of mandible. So this is going to supply the skin over the angle of mandible. The auriculotemporal nerve will be coming here like this. It will be coming here. That's the auriculotemporal nerve. Auriculotemporal nerve is here. So this is the greater auricular nerve, and this greater auricular nerve supplies the lower part of the pinna. It supplies the skin over the angle of the mandible. The skin over the angle of the mandible is supplied by greater auricular nerve. Now, when there's a lesion here, when there's a lesion of the skin over the parotid gland, there's a mixing of two fibers. There's a mixing of fibers of greater auricular nerve and auriculotemporal nerve. There's a mixing of fibers. When there's a lesion of the skin over the parotid gland, there are two fibers which gets mixed, the fibers of greater auricular nerve and the fibers of auriculotemporal nerve, they get mixed. So when a person is salivating, the person starts to get sweating of the skin over the parotid gland. So when the person is salivating, the person gets sweating of the skin over the parotid gland. What is that? What is that? Any guesses? This is what we call as the Fraze syndrome. That's Fraze syndrome. So what is Fraze syndrome? Fraze syndrome is the sweating of the skin over the parotid gland during food, during having food, during salivation. That is Fraze syndrome. Okay, students, fine. So just remember this. Auriculotemporal nerve is a branch of, yes, it's a branch of mandibular nerve. Facial nerve, lesser occipital nerve, that's fine. So answer is auriculotemporal. The answer for this is greater auricular nerve. Clear? Fraze syndrome. Very good. Very good. And what is crocodile tears? Crocodile tears, you know, when a person is salivating, the person gets tears. That is crocodile tears. That is crocodile tears. When a person is salivating, when a person gets tears, that's crocodile tears. When a person is salivating, the sweating of the skin over the parotid gland, that's Fraze syndrome. That's Fraze syndrome. Perfect. Gustatory. Fine. Gustatory. Very good. Very good. Chalo, coming to the next MCQ. Here we are. A patient cannot dorsiflex his foot after leg injury. Which nerve supplies the involved muscle? So tell me, ankle joint, there are two movements which are possible. One is dorsiflexion, one is plantar flexion. Dorsiflexion is done by which compartment? Anterior compartment muscle. So which is the nerve which supplies the anterior compartment? Which is the nerve which supplies the anterior compartment? That's a deep peroneal nerve. Deep peroneal nerve. So answer is a deep peroneal nerve. Deep peroneal. I'll just give you one small flow chart. Sciatic nerve divides into a tibial and a common peroneal nerve. Common peroneal nerve winds around the neck of the fibula. Common peroneal nerve winds around the neck of fibula and divides into a superficial peroneal nerve and a deep peroneal nerve. Now, deep peroneal nerve goes to the anterior compartment of the leg. This goes to the lateral compartment, and this goes to the posterior compartment of the leg. Posterior compartment of the leg, right? What is the action of muscles of posterior compartment? This is plantar flexion and inversion. Plantar flexion and inversion. This is eversion. And this anterior compartment muscle does dorsiflexion. Okay, so damage to this will lead to foot drop. Fine. So just remember the small flow chart. It's very easy, and many of the MCQs gets cleared because of this. So foot drop is a condition when dorsiflexion is not possible. The foot goes down. That's foot drop. Foot drop occurs due to injury to, your first answer is a common peroneal nerve. If common peroneal nerve is not in the option, the answer is deep peroneal nerve. Fine. Okay, I hope this is clear. So answer is deep peroneal nerve. Clear? All of you have written this. सबने लिखा है deep peroneal nerve. Yes, very good. That's a deep peroneal nerve. बाकी सब clear है ना? The rest of the things are clear to you. So tibial nerve supplies the posterior compartment of the leg. Action is plantar flexion and inversion. Superficial peroneal nerve supplies the lateral compartment. Action is eversion. And the deep peroneal nerve supplies the anterior compartment. Answer is action is dorsiflexion. Fine है बच्चों, समझ में आ रहा है? Any doubts? Fine, ठीक है. Okay, coming to the next. Which part of the pancreas is derived from the dorsal pancreatic bud? Yes, anyone? Dorsal pancreatic bud. So let us come to this, the development of pancreas. Have a look. So this is the duodenum, this is the dorsal pancreatic bud, and that's the ventral pancreatic bud, So that's a dorsal, that's a ventral pancreatic bud. Now, if that's a dorsal bud, the ventral bud, this is the ventral bud. The ventral bud goes from backside and joins with the dorsal bud. Fine. So ventral bud goes from behind, joins with the dorsal bud. What does the dorsal bud form? The upper part of the head, neck, body, and the tail of the pancreas. Upper part of the head, neck, body, and tail of the pancreas. The ventral pancreatic bud forms the lower part of the head and the uncinate process. Lower part of the head and the uncinate process is derived from the ventral pancreatic bud. Fine. So this is the upper part of the head, the neck, the body, and tail of the pancreas derived from the dorsal bud. The ventral part of the head and the uncinate process is derived from the ventral pancreatic bud. Fine, clear to all of you? Yes. So what is the answer for this? What do you write for this? Come on, students, what do you write for this? Which part of the pancreas is derived from the dorsal pancreatic bud? What do you say? Yes, what is the answer for this? Yes. Come on, come on, come on, answer. I'm waiting for your answer. So answer is neck, body, and tail. Head, they have not specified. Which part of the head is not specified? So we don't take the head in the answer. Answer is neck, body, and tail. The head, neck, body, and tail is derived from dorsal bud, but the upper part of the head is derived from the dorsal bud. So the answer here is B. Answer here is going to be B. Clear? Okay, now there are two pancreatic buds. What is the main pancreatic bud? No, I mean, what is the main pancreatic duct known as? Any guesses? The main pancreatic duct and the accessory pancreatic duct. There are two pancreatic ducts. What is the main pancreatic duct known as? Any guesses? Any guesses? The main pancreatic duct is known as the duct of Wirsung, and the accessory pancreatic duct is known as the duct of Santorini. Fine. So the main pancreatic duct is the duct of Wirsung. The accessory pancreatic duct is known as the duct of Santorini. Fine. Clear है students? बच्चों समझ में आ रहा है? Now this ventral pancreatic bud goes from backside. ये पीछे से जाता है. It joins with the dorsal bud. Sometimes half of the ventral bud. Look, this is the duodenum. That's the dorsal pancreatic bud, and that's the ventral pancreatic bud. है ना? So sometimes half of the ventral bud आगे से जाता है, half of the ventral bud goes from backside. Such a type of pancreas is going to encircle the duodenum. This is what we call as an annular pancreas, correct? Annular pancreas occurs due to defective migration of, yes, the ventral pancreatic bud. बच्चों याद रखना, only one bud is going to migrate. That's a ventral pancreatic bud, right? So ventral pancreatic आधा आगे से जाता है, आधा पीछे से. Half goes from front, half goes from behind. So that is annular pancreas. Annular pancreas occurs due to improper migration of ventral pancreatic bud. And sometimes this dorsal and the ventral bud do not fuse. They do not fuse. Then we get a divided pancreas. That is pancreatic divism. So pancreatic divism occurs due to non-fusion of the two buds. Clear? Can anyone tell me which part of the pancreas contains the maximum islets of Langerhans? Come on. Maximum islets of Langerhans are present in which part of the pancreas? The tail of the pancreas, tail. And which part of the pancreas is more prone to cancerous changes? Head of the pancreas. Head of the pancreas is more prone to cancer. The tail contains the maximum islets of Langerhans. So when we are doing a splenectomy, the tail of the pancreas enters the spleen. So when we are removing the spleen, when we are doing a splenectomy, we have to be very careful to preserve the tail of the pancreas. Right? So just remember all these things. Very important. So I've told you everything about the pancreas, right? Perfect, perfect, perfect. See the next. Identify the mark structure in the given image. Okay, can anyone tell me what are these? What is this mark structure? What is that mark structure? Yes, 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 yes. I'm waiting for your answer. Your answer, then we'll discuss. the mark structure in the given image. Students, any guesses? So this is the development of tongue. That's the development of tongue. Tuberculum impar nahi hai bachche. It's not tuberculum impar. No, 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 no. Okay, I'll tell you. Just one moment. One moment. I'll tell you. Don't worry. I'm here. Don't worry. Now look. This is the ectodermal cleft, 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 cleft. These are the endodermal pouches, 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 pouches. Endodermal pouches, 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 pouches. This is the ectodermal cleft, 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 cleft. What is this now? First pharyngeal arch, second pharyngeal arch, third, fourth, and sixth pharyngeal arches. In the first pharyngeal arch, we get two swellings here. In the first pharyngeal arch, we get two swellings. This is what we call as the lingual swellings. Lingual swellings. And we get another swelling behind it. We get another swelling here. This is what we call as the tuberculum impar. Okay, so was that not looking? Oh, these are the two. No, they have shown two things. No, so these are the two lingual swellings. Below the lingual swellings, there is going to be the tuberculum impar, right? So these are the two lingual swellings. Sorry, these are the two lingual swellings. That's the tuberculum impar. In the third and the fourth arch, you get what is known as the cupula or the hypobranchial eminence. Hypobranchial eminence, right? This divides into a cranial part and a caudal part, cranial and caudal part. So now you tell me the two lingual swellings and the tuberculum impar are going to form what? The anterior two-thirds of the tongue. Anterior two-thirds of the tongue is derived from the first pharyngeal arch. Nerve hai, mandibular nerve. So anterior two-third is supplied by lingual nerve, a branch of mandibular, that's lingual nerve. Posterior one-thirds of the tongue is derived in the third arch, which is the nerve here. This is the glossopharyngeal nerve. Third arch ki nerve hai glossopharyngeal nerve. So posterior one-thirds is derived from glossopharyngeal nerve. The posterior most part of the tongue, okay, that is derived from the this part. This is the caudal part of hypobranchial eminence and the epiglottis. That is derived. So this is supplied by the vagus, the internal laryngeal nerve. That's a branch of vagus. So two lingual swellings and tuberculum impar क्या बनाता है? Anterior two-thirds of the tongue बनाता है, supplied by lingual nerve. First arch की nerve है mandibular nerve, so it's a branch of mandibular, that's lingual. Posterior one-thirds of the tongue is derived in the third arch from the cranial part of the hypobranchial eminence, supplied by glossopharyngeal nerve. The posterior most part of the tongue is derived from the fourth arch, supplied by internal laryngeal nerve. उसके साथ और क्या बनता है? What else is formed? Epiglottis. Epiglottis. Fine, students. So answer is lingual swellings. Lingual swellings. ठीक है? Is this clear? Just tell me who supplies taste sensations to the anterior two-thirds. Come on. Who supplies the taste sensations to the anterior two-thirds of the tongue? Anyone? Any guesses? Who was the one जो taste sensation supply करता है to the anterior two-thirds of the tongue? Yes. Anterior two-thirds जनरल sensations is lingual, special sensation taste sensation कौन supply करता है? Chorda tympani. Chorda tympani, that's a branch of facial nerve. Chorda tympani is a branch of facial nerve. Fine. Okay. हाँ, क्या लिखा है? क्या लिखा है? Okay, answer this. What is the nerve that passes through the mark structure in the given image? Now you tell me. This is the mark structure. This is the mark structure. What is this foramen known as? ये foramen का नाम है mandibular foramen. That's a mandibular foramen. What is the structure which enters into it? Seven nerve, बच्चे, seven nerve. Anterior two-thirds of the tongue. Special sensation is chorda tympani. That's a branch of facial nerve. It's a branch of facial nerve. Yes, tell me what is the answer for this? It's the inferior alveolar nerve. Very good. Which is a nerve which enters into the mandibular foramen. यहाँ से एक nerve जाती है इसके अंदर. There's a nerve which enters the mandibular foramen. It goes like this, like this, like this, like this, and it emerges out from here. यहाँ पे एक foramen है. What is this nerve now known as? Mental nerve. That nerve is known as mental nerve. Okay. So the inferior alveolar nerve enters the mandibular foramen and emerges out as mental nerve. Mental nerve. Fine. Okay. What is this part of the mandible? कोई बोल सकता है what is this part of the mandible known as? इसको बोलते हैं pterygoid fovea. Can anyone tell me what is attached here to the pterygoid fovea? Come on, students. There's one muscle of mastication which is attached to the pterygoid fovea. Naam batao. Name of the muscle. Any guesses? What is the muscle which is attached to the pterygoid fovea, to the neck of the mandible? ये neck है, neck पे एक depression है. That's a pterygoid fovea, which is the muscle attached to the pterygoid fovea. Come on, students. You can answer this. Take this question. फटाफट ले लो. Answer करो. The muscle attached to the pterygoid fovea. Any guesses? Come on, students. You should be able to answer this. What is this muscle which is attached to this process here? ये B लिखता हूँ, ये A लिखता हूँ, and what is the muscle attached here? यहाँ पे C लिखता हूँ, which is the muscle attached here? ये D लिखता हूँ. चलो बोलो. ये एक visual slide है आपके लिए. This is a visual slide for you. Any guesses? Any guesses? What is masseter? कौन सा नंबर है? What is masseter? निखिल कौन से नंबर को बोल रहे हो? Masseter? Which muscle is निखिल ये वाले? हाँ, very good. बोलो. B masseter नहीं है बच्चे. B is not masseter. Number A is lateral pterygoid. Lateral pterygoid. B is temporalis. Temporalis. C is masseter. And D is, D का है? Medial pterygoid. Okay, so these are the muscles of mastication. ये याद रखना, these are the muscles of mastication which are attached to the mandible. ये याद रखना. Fine. Very important है, ये सब बहुत important है. बाकी lingual nerve supplies the anterior 2/3 of the tongue. Fine. Clear है? So just remember this attachment of muscles. ये है lateral pterygoid inserted on the neck of the mandible. Angle of the mandible बाहर की तरफ, outside is masseter. Angle of the mandible अंदर की तरफ is medial pterygoid. This is the temporalis. Temporalis attached to the coronoid process of mandible. Coronoid process of mandible. Fine. Okay, great, very nice. Chalo, next, students. Injury to ulnar nerve at the elbow most classically produces which deformity? Ulnar nerve at the elbow. हाँ, क्या होगा? Ulnar nerve at the elbow. Any guesses? Yeah. Ulnar nerve at the elbow produces which deformity? Yes. Answer. I'm waiting for your answer. Any guesses? That is claw hand. Claw hand. Ulnar nerve. Answer is claw hand. C नहीं है बच्चे. Wrist drop नहीं है. Wrist drop नहीं है. Wrist drop is due to radial nerve. Wrist drop is because of radial nerve injury. Radial nerve की injury से wrist drop होता है. The muscle is ECRL. Extensor carpi radialis longus का paralysis होता है. You get a wrist drop. ठीक है. The extensor carpi radialis longus की paralysis से wrist drop मिलता है. Claw hand. Who causes flexion at metacarpophalangeal joints and extension at interphalangeal joints? The lumbricals. The lumbricals, the lateral two and the medial two. Medial two is supplied by ulnar nerve. The lateral two is supplied by the median nerve. ठीक है ना? What is the action of lumbricals? Flexion at metacarpophalangeal joints, extension at interphalangeal joints. So if the ulnar nerve is damaged, you get paralysis of these two lumbricals. You get a claw hand of the ring finger and the little finger. You get a claw hand of these two digits. अगर medial nerve injury होती है, you get a claw hand of these two digits. Fine. So that's a lumbrical. Medial two is supplied by ulnar nerve. The lateral two is supplied by, yes, medial nerve. Eighth thumb deformity, which nerve is that? Median nerve. Median nerve injury से में होता है eighth thumb deformity. Waiter's stiff hand. बच्चे बोल सकते हो waiter's stiff hand कब होता है? When do you get a waiter's stiff hand or a policeman's stiff hand? कब होता है? In which lesion do you get a waiter's stiff hand? Partial claw hand. बराबर है. Stannon Lee. हाँ, partial claw hand. Very good. वेरी गुड, एक्सलेंट, बहुत अच्छे आंसर कर रहे हो, ऐसे ही लगे रहो, ऐसे ही लगे रहो, you'll get very good marks, you'll definitely crack the FMG एग्जाम. चलो, वेट अ स्टिप हैंड, where do you get? हाँ ठीक है, अल्नार पैराडॉक्स ठीक है बच्चे, Erb's paralysis, yes, that is Erb's paralysis. This you get in Erb's paralysis. Excellent. Erb's paralysis, you get a waiter stiff hand, porter stiff hand, or policeman stiff hand. Excellent. Very good. Very good. Shubham. Very good. Okay, chalo, great. Thank you, Shubham. Chalo, we'll see the next MCQ. Come on, identify the muscle along with its action. Yes, muscle. ये कौन सा muscle है बोल सकते हो? Which is this muscle? Which is this muscle? ये क्या मसल है? A muscle which begins from the metacarpal bones. Metacarpal bones. Lumbricals कहाँ से arise हो रहे थे? Lumbricals were arising from the tendons of profundus. वो profundus के tendon से arise हो रहे थे. बोलो. बोलो 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 बोलो. What is this? What is this? This is the introsha. Very good. These are the dorsal introsha. ये मसल को क्या बोलते हो? बाइपिनेट मसल. अगर पामर इंट्रोशा देखते हो, पामर इंट्रोशा आर यूनिपिनेट है ना. पामर इंट्रोशा आर यूनिपिनेट, ये है डॉर्सल इंट्रोशा, बिकॉज ये दो बोन से अराइज होते थे, अराइज फ्रॉम टू बोन्स. ये है डॉर्सल इंट्रोशा. एंड व्हाट इज द एक्शन ऑफ डॉर्सल इंट्रोशा? दैट्स abduction of fingers. डॉर्सल इंट्रोशा का एक्शन इज abduction of fingers. Palmar introsci का action is adduction of fingers. Palmar introsci is adduction. Huh? Okay, so this is answer is C बच्चे. Answer is C for this. हाँ, answer C है. B नहीं है निखिल. Answer is not B. Answer is C. Dorsal introsci है ये बाइपिनेट मसल्स है, सो दैट इज डॉर्सल इंट्रोशा. व्हाई इज दिस नॉट पामर इंट्रोशा? पामर इंट्रोशा यूनिपिनेट होते हैं, दे अराइज फ्रॉम वन बोन. हाँ, वन एक बोन से अराइज होता है. पामर इंट्रोशा दे आर यूनिपिनेट. ये डॉर्सल इंट्रोशा है, दे आर बाइपिनेट. एनीवन, कैन एनीवन टेल मी द नर्व सप्लाई ऑफ द इंट्रोशा? कम ऑन, इंट्रोशा का नर्व सप्लाई क्या होगा? अल्नार नर्व. अल्नार नर्व. सारे इंट्रोशा, ऑल द इंट्रोशा, वेदर इट्स डॉर्सल वेदर इट्स पामर, सब सारे इंट्रोशा को कौन सप्लाई करती है? Ulnar nerve. Ulnar nerve. Excellent. Very good. Very good. Excellent, बच्चों. Very good. Identify the bone labeled in the image of the foot. क्या लगता है? What is this bone? ये कौन सा aspect है? पहले देख लो. Which is this aspect? Yes, yes. Which is this aspect? Is this medial side of the foot or is it the lateral side of the foot? पहले वो देखना है आपको. How do you know this? How do you know this? Whether it's medial aspect or lateral aspect? तो दैट्स अ ग्रेट टो है ना, ये ग्रेट टो है. सो दिस इज द मीडियल एस्पेक्ट, दैट्स अ मीडियल साइड ऑफ द फुट. दैट्स अ मीडियल साइड ऑफ द फुट. व्हाट इज दिस बोन? ये बोन देख रहे हो? दैट्स अ मीडियल मैलुलस. दैट्स अ मीडियल मैलुलस. दिस इज गोइंग टू बी द कैल्किनियम. दिस इज द कैल्किनियम. यहाँ पे ऊपर आएगा टैलिस. व्हाट कुड दिस बोन बी? ये ऐसे बोट शेप्ड बोन रहता है. व्हाट इज दैट बोन व्हिच इज बोट शेप्ड? वेरी गुड, एक्सीलेंट. मीडियल साइड है. सो ये है मीडियल मैलुलस, बराबर है ना. ये है मीडियल मैलुलस. दैट्स अ कैल्किनियम. यहाँ पे टैलिस आएगा. व्हाट इज दिस बोन? एंड देन यू गेट दिस. हाँ. ये कौन है? ये है अपना navicular. दिस इज अवर navicular bone. हाँ, the one which is pointed out is navicular. ये कौन है? This is the navicular bone. On the medial side you get the navicular bone on the medial side. Very good बच्चों. Excellent, excellent. Very good, very good. So that's a navicular bone. ये आएगा first metatarsal bone. फिर ये आएंगे phalanges. This are going to be the phalanges, right? So that's the medial malleolus, that's the calcaneum, that's the talus. ये आएगा navicular, and then that's the first metatarsal bone, and then you'll get the two phalanges, right? Excellent. This is the medial longitudinal arch here. Medial longitudinal arch. So that bone is going to be the navicular. Answer is D. Cuboid is on the lateral side. Cuboid lateral side पे है ना. Cuboid is on the lateral side. Okay, fine. Which cranial nerve exits the skull through the jugular foramen? Yes, any guesses? Which cranial nerve exits the skull through the jugular foramen? Bolo. अब जुगुलर फोरामेन हैज गॉट 3 कंपार्टमेंट्स, राइट? ऐसे 3 कंपार्टमेंट्स होते हैं जुगुलर फोरामेन के. There is one vein which gets out through the posterior compartment of the jugular foramen. There's one vein which gets out through the anterior compartment of the jugular foramen. Yes, what is this? ये कौन है? That's the sigmoid sinus. Sigmoid sinus gets out through the posterior compartment. अब ये बना internal jugular vein. अब ये बना internal jugular vein. And what is this? This is the inferior petrosal sinus. That's the inferior petrosal sinus. This comes out through the anterior compartment. So anterior compartment से आती है inferior petrosal sinus. This inferior petrosal sinus becomes the first tributary. ये बनता है first tributary of internal jugular vein. And middle compartment से कौन जाता है? Very good, आपने सही लिखा है. Middle compartment से जाता है 9th, 10th and 11th cranial nerves. 9th, 10th and 11th cranial nerves pass through the middle compartment. So what is the answer for this? D. Answer D है all of the above. All of the above. 9th, 10th and 11th cranial nerve passes through the middle compartment. बच्चे याद रखना jugular foramen is very important. Middle compartment से जाती है 9th, 10th, 11th cranial nerves. Anterior compartment से जाता है inferior petrosal sinus and posterior compartment से जाती है sigmoid sinus. The sigmoid sinus continues. Now it becomes the internal jugular vein and the inferior petrosal sinus comes and joins the internal jugular vein. MCQ है first tributary of internal jugular vein is your answer inferior petrosal sinus. Inferior petrosal sinus. ठीक है, तो काफी कुछ समझ में आता है इसमें MCQs में. Just try to understand this. Fine, perfect. Which muscle is innervated by the inferior gluteal nerve? Come on students, a very important MCQ. बहुत बार पूछा गया है. Which muscle is innervated by the inferior gluteal nerve? बोल सकते हो? Out of all this, inferior gluteal nerve. Any guesses? Any guesses? Bolo, bolo, bolo. Bolo, bolo, bolo. हाँ, Bago accessory complex is fine. Which is the muscle innervated by the inferior gluteal nerve? Gluteus maximus. Very good. So answer for this is gluteus maximus. Gluteus maximus is innervated by the inferior gluteal nerve, and the superior gluteal nerve जो है, superior gluteal nerve supplies these 3 muscles. Superior gluteal nerve supplies the gluteus medius, the gluteus minimus and the tensor fascia lata. The gluteus medius, minimus and tensor fascia lata को कौन सप्लाई करता है? Superior gluteal nerve. बच्चे एक बोल सकते हो, what is the main action of gluteus maximus? The main action of gluteus maximus. Any guesses? आप बैठे हो, you're sitting down, when you stand up, that is the action of gluteus maximus. वो क्या है? Extension at the hip joint, right? So the main action of gluteus maximus क्या होता है? Extension at the hip joint. Second, lateral rotation and abduction. Abduction at the hip joint. याद रखना. So the main action of gluteus maximus is extension. Main action is extension. Second action is abduction. तीसरा है lateral rotation at the hip joint. Fine. Adduction नहीं है बच्चे, abduction है. What is the main action of gluteus medius? Gluteus medius का main action is abduction. Main action of gluteus medius is abduction. Gluteus minimus is medial rotation. Medial rotation. So main action of medius is abduction. Main action of minimus is medial rotation. Maximus का main action is extension. ये याद रखना, ये पूछते हैं. This is asked. And all these 3 muscles are supplied by superior gluteal nerve. ये है inferior gluteal nerve. Very good, very good. बच्चों, very good. एक और एक्शन है ग्लूटियस मीडियस एंड मिनिमस. लेट मी टेल दिस टू यू. एक और एक्शन है ग्लूटियस मीडियस एंड मिनिमस का. दे सपोर्ट द पेल्विस व्हेन वन फुट इज ऑफ द ग्राउंड. व्हेन वी लिफ्ट वन फुट तो पेल्विस नीचे गिरेगा, तो ऑपोजिट साइड का ग्लूटियस मीडियस मिनिमस क्या करेगा? इट विल सपोर्ट द पेल्विस. व्हेन वन फुट इज ऑफ द ग्राउंड, दे स्टेबलाइज द पेल्विस. व्हेन वन फुट इज ऑफ द ग्राउंड, अगर ग्लूटियस मीडियस एंड मिनिमस पैरेललाइज होता है तो पेल्विस फॉल्स टू द ऑपोजिट साइड. This is Trendelenburg sign. वो गेट को बोलते हैं लर्चिंग गेट, लर्चिंग गेट. If both the glutei are paralyzed, that is known as waddling gait, waddling gait. That's fine, बच्चे. Just try to listen, try to understand. That's okay. हाँ, you have to read, revise, revise. कुछ नहीं है, कुछ difficult नहीं है, कुछ. There's nothing bad. You have to revise it. हाँ, you just put in some efforts, हो जाएगा. Okay, बच्चों, come on next. Which part of the temporal bone houses the organ of hearing, vestibular apparatus, and the auditory ossicles? बोल सकते हो? हाँ, ये बोल सकते हो? So ये जितने भी parts हैं ना, this are all parts are of which bone? ये सारे किसके bone के parts हैं? Temporal bone. ये टेम्पोरल बोन के पार्ट्स हैं. दिस आर ऑल पार्ट्स ऑफ टेम्पोरल बोन. मैस्टॉइड प्रोसेस पता है आपको? मैस्टॉइड प्रोसेस पीछे है. यू नो द स्क्वैमस पार्ट, ये जो है ना जहां पे गन रखते हैं, वी पुट द गन हियर, दैट्स द स्क्वैमस पार्ट ऑफ टेम्पोरल. मैस्टॉइड पार्ट आपको पता है पीछे है. Tympanic plate. Tympanic plate is at the base of the skull. Answer is petrous part of the temporal bone. Petrous part of temporal bone is very hard like a rock. बहुत ज्यादा hard होता है ये petrous part. And बहुत ज्यादा hard होता है. It's very hard, and that is why the ear ossicles जो है, it is present in the petrous part of temporal bone. So petrous part of temporal bone में होते हैं अपने ear ossicles, right? So remember this. This is very important. So petrous part. बाकी squamous part is this. मैस्टॉइड पीछे है, टिम्पैनिक प्लेट नीचे होता है, बेस ऑफ द स्कल पे. हाँ, द टिम्पैनिक प्लेट इज एट द बेस ऑफ द स्कल. ओके, फाइन बच्चों, समझ में आ रहा है? एंजॉइंग? See the next. Which muscle abducts the thigh at the hip joint? Come on, bachcho. This I've told you now. I've told you this. Which muscle abducts the thigh at the hip joint? चलो बोलो. Which is the chief abductor at the hip joint? ये मैंने अभी बोला आपको. I've just told you this. Which is the chief abductor of the hip joint? Any guesses? Yes. Iliopsoas नहीं है बच्चे. Honeybee. It's not iliopsoas. नहीं. आंसर इज मीडियस बच्चे. मीडियस, ग्लूटियस मीडियस है. अभी मैंने बोला ना बच्चे, ग्लूटियस मीडियस इज द चीफ एबडक्टर एट द हिप जॉइंट. ग्लूटियस मैक्सिमस का मेन एक्शन क्या है? मेन एक्शन इज एक्सटेंशन. इसका मेन एक्शन इज एक्सटेंशन एट द हिप जॉइंट. मीडियस का मेन एक्शन इज एबडक्शन एट द हिप जॉइंट. एंड मिनिमस का मेन एक्शन इज medial rotation. याद रखना, medial rotation at the hip joint. That's the main action of minimus. हाँ, ठीक है. What is the action of iliopsoas? Iliacus and psoas major ये करेंगे. ये what is this? Flexion at the hip joint. Sorry, flexion at the hip joint बोलो या flexion at the vertebral column बोलो. That is done by iliopsoas. Flexion at the vertebral column or flexion at the hip joint. That's iliopsoas. Adductor longus क्या करेगा? Adduction at the hip joint. नाम ही है adductor longus. नाम ही adductor longus, so it will do adduction at the hip joint. Fine. बच्चे याद रखना. Just remember the nerve supply of all this. हाँ, nerve supply याद रखना. That's very important. एक छोटा सा चीज बोलता हूँ, just for your benefit. You know obturator nerve. ऑब्चुरेटर नर्व पे बहुत एमसीक्यूज रहता है. ऑब्चुरेटर नर्व डिवाइड्स इनटू एन एंटीरियर डिवीजन एंड अ पोस्टीरियर डिवीजन. ओके, ऑब्चुरेटर नर्व के दो डिवीजन है, एंटीरियर पोस्टीरियर. व्हाट इज द एंटीरियर डिवीजन सप्लाई? एंटीरियर डिवीजन सप्लाइज द एडक्टर लॉन्गिस, एडक्टर ब्रेविस, एडक्टर लॉन्गिस, एडक्टर ब्रेविस, ग्रेशियालिस एंड पेक्टिनियस. ये एमसीक्यू में नहीं है, आई एम जस्ट टेलिंग यू एन एक्स्ट्रा थिंग, एक्स्ट्रा चीज बोला. So anterior division of obturator nerve क्या supply करती है? Adductor longus, adductor brevis, gracialis and pectineus. Pectineus का medial half. Posterior division of obturator nerve क्या supply करता है? Adductor magnus and obturator externus. ये सारे मसल्स हैं मीडियल कंपार्टमेंट में. These are all the muscles in the medial compartment of the leg. All these muscles are going to cause adduction at the hip joint. ये जितने भी muscles हैं, they are going to cause adduction at the hip joint, except, याद रखना, except ऑब्चुरेटर एक्सटर्नस ये क्या करता है? दिस इज गोइंग टू कॉज एक्सटर्नल रोटेशन और लैटरल रोटेशन. ये जितने भी मसल्स हैं दे कॉज एडक्शन एंड मीडियल रोटेशन एट द हिप जॉइंट. जितने भी मसल्स आप देख रहे हो दे कॉज एडक्शन एंड मीडियल रोटेशन एट द हिप जॉइंट. बस एक एक्सेप्शन है, ऑब्चुरेटर एक्सटर्नस ये करता है लैटरल रोटेशन. याद रखना, बहुत इंपॉर्टेंट है, बहुत इंपॉर्टेंट. Obturator externus does lateral rotation at the hip joint. Remember that, students. Fine. Okay, so that is one extra thing I told you. Extra चीज मैंने बोला. हाँ, ठीक है, याद रखोगे. Okay. Identify the triangle shown in the image. हाँ, क्या बोलो बच्चे? Gemellus superior नहीं बच्चे, superior gemellus पीछे है. Superior gemellus gluteal region में है बच्चे. Superior gemellus is in the gluteal region. That is supplied by different nerve. Superior gemellus is supplied by nerve to obturator internus है वो बच्चे. That is nerve to obturator internus. Obturator internus अलग है, obturator externus अलग है. Gemellus पीछे है gluteal region में. ये जो मैंने आपको बोला, this is the medial compartment of the thigh. वो है adductor compartment of the thigh. अमित, समझ में आ रहा है ये बच्चे? समझ में आ रहा है? Okay, chalo. Now see this. Identify the triangle. What is this triangle? That's a submental triangle. Okay, that's a submental triangle. This is the submental triangle. Okay, I'll just draw one slide for you. फटाफट ये triangles के नाम बताइए. Look, this is beautiful. This is beautiful. Okay, I'll start. ये है अपना mastoid process. This is the sternocleidomastoid muscle. ये sternocleidomastoid है. What is this muscle? ये है अपना trapezius. That's the body of the mandible. That's the ramus of the mandible. ये है midline of the neck. ये है clavicle. Clavicle. आप imaginary line draw करते हो. You draw an imaginary line from the angle to the mastoid process. ये बन गया side of the neck. This neck is divided into two triangles by sternocleidomastoid. ये है अपना anterior triangle and that's the posterior triangle. Fine. Now, what is this bone? Hyoid bone. फटाफट एक triangles बताता हूँ. What is this muscle? This is the omohyoid. Omohyoid. This is the inferior belly of omohyoid and ये है अपना superior belly of omohyoid. Fine. What is this muscle? This is going to be the digastric. Digastric. This is the posterior belly of digastric and this is the anterior belly of digastric. Anterior belly of digastric. चलो बच्चों बोल सकते हो? Can anyone answer this? This is number 1. This is number 2, 3, 4, 3, 4, 5 and 6. नाम बताओ. Just name these triangles. Name these triangles. Come on, students, you know this. Come on, you can answer this. Guess this, answer this. Posterior triangle के दो triangles बन गए. ये posterior triangle है. This is the anterior triangle. Posterior triangle के दो triangles बन गए. What is number 1? Number 2? Come on, answer. Any guesses? ये इस पर बहुत MCQs आते हैं. The plenty of MCQs on the boundaries of this triangle. हाँ, नाम बताओ नाम. नेम द ट्राइंगल. नंबर 1 ट्राइंगल कौन है? ऑक्सीपिटल ट्राइंगल. एक्सीलेंट बच्चे, वेरी गुड वेरी गुड. हाँ, नंबर 1 इज द ऑक्सीपिटल ट्राइंगल. हाँ, नंबर 2 कौन है बोलिए? ऑक्सीपिटल ट्राइंगल. नंबर 2 इज सुप्राक्लाविकुलर ट्राइंगल. नंबर 2 इज सुप्राक्लाविकुलर ट्राइंगल. ठीक है. नंबर 3 बताओ. 3 कौन है? 3 इज द मस्कुलर ट्राइंगल. 3 is the muscular triangle. 4th, carotid triangle. Carotid. 5th, digastric triangle. 6th, submental triangle. That's a submental triangle. हाँ, very good. बहुत अच्छे. Attempt करो बच्चों. See, attempt करो. Even if it is wrong, it's okay. बहुत सीखने को मिलता है. You get to learn many things. When you make a mistake, you'll always remember it. ठीक है ना? तो यहाँ पे गलती करोगे, that's okay. फाइनल में गलती नहीं करना. right? So now you tell me, what are the boundaries of this posterior triangle? Sternocleidomastoid, trapezius, ये trapezius है, ये clavicle है. That's the inferior belly of omohyoid. तो ये होता है occipital triangle, ये supraclavicular triangle. ये नंबर 3 देखिए, that's the superior belly of omohyoid, that's the sternocleidomastoid, that's the midline of the neck. यहाँ है muscular triangle, muscles होते हैं यहाँ पे, muscle strap muscles. इसके boundaries देखिए, the sternocleidomastoid, the posterior belly of digastric and the superior belly of omohyoid, that's a carotid triangle. Anterior belly of digastric, posterior belly of digastric, the body of the mandible, that's the digastric triangle. And this is the submental triangle. Submental triangle. Perfect है? बच्चों क्लियर है? Enjoying? समझ में आ रहा है? Okay, चलो, we'll proceed to the next. Bones involved in formation of the pterion. चलो, answer this. This is an easy MCQ. Bones involved in the formation of pterion. बोल सकते हो? Any guesses? टेरियन क्या होता है? टेरियन इज एन एच शेप्ड सूचर हियर, है ना? एच शेप्ड सूचर होता है यहाँ पे. दिस इज व्हाट वी कॉल एज द टेरियन. यहाँ पे ऐसे एक एच शेप्ड सूचर होता है ऑन द साइड ऑफ द स्कल, एंड दिस इज फॉर्म्ड बाय which bones? The parietal bone, the frontal bone, the sphenoid bone, and the temporal bone. Temporal bone, बराबर है? 4 bones होते हैं यहाँ पे. That's a frontal, that's a parietal, that's a temporal, and that's a sphenoid. नीचे से एच शिफ्ट आता है. हाँ, सो एच शिफ्ट सूचो, ये पैराइटल बोन है, ये आगे फ्रंटल है, पीछे टेम्पोरल है, एंड नीचे से स्फीनॉइड बोन आता है. द एच शिफ्ट सूचर इज नोन एज द टेरियन. एंड हु लाइज डीप टू दिस टेरियन? इसके नीचे कौन होता है? हु लाइज डीप टू द टेरियन? एनी गेसेस? हु लाइज डीप टू द टेरियन? व्हाई इज दिस सो इंपॉर्टेंट? बिलो द टेरियन लाइज the stem of lateral sulcus, stem of the lateral sulcus, and the anterior branch of middle meningeal artery. Stem of lateral sulcus होता है इसके नीचे, and the anterior branch of middle meningeal artery. Yes, honeybee. Very good. हाँ, ठीक है. Yes, very good. The middle meningeal artery बोलो या anterior branch of middle meningeal artery बोलो, that's one and the same. And the stem of lateral sulcus that lies below the terion. Right? Great. Very nice. Very nice. बहुत अच्छे. बहुत अच्छे. ठीक है ये बच्चों. चलो. Which nerve innervates the diaphragm? Easy MCQ. Easy. ऐसे easy MCQs आने चाहिए. Oh my God, you'll get. You can score very good marks, है ना? Which nerve innervates the diaphragm? बोल सकते हो? चलो ये easy है. आप बताओ. अब बताओ, अब बताओ, अब बताओ. Which is the nerve which innervates the diaphragm? I'm definitely sure आप बहुत अच्छा परफॉर्म करोगे. You answering very 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 well. बहुत अच्छा आंसर कर रहे हो. So which is the nerve innervating the diaphragm? बच्चे phrenic nerve. Very good. Phrenic nerve. Phrenic nerve. Excellent. अब बोल सकते हो what is the root value of phrenic nerve? Root value, root value, root value बोल सकते हो. अभी देखो ना कैसे, see how you are going to revise it. अब phrenic nerve आ गया ना, तो what do you know about the phrenic nerve? बोलो. चलो, what do you know about the phrenic nerve? Number 1, root value. Root value बोल सकते हो phrenic nerve की root value. तो ऐसे रिवाइज करना, तो if you revise it like this ना, तो सारे important points cover हो जाते हैं. So the root value of phrenic nerve is C3, C4, C5. C3, C4, C5. That's the root value of phrenic nerve. ये जो phrenic nerve है ना, it lies on a muscle. Which muscle is that? The scalenus anterior. Lies on scalenus anterior muscle. ये सब MCQs है बच्चे. These are all MCQs. Lies on the scalenus anterior. Then lies in front of the hilum. Lies in front of hilum of lung. Hilum of the lung. So nerve in front of the hilum कौन है? Phrenic nerve. Nerve behind the hilum कौन है? Vagus. Easy. Nerve in front of the hilum is phrenic nerve, and the nerve behind the hilum is vagus nerve. याद रखना. So phrenic nerve की root value है C3, C4, C5. Lies on the scalenus anterior muscle of the neck here. फिर वो थोरैक्स में जाती है, देन इट गोज इन फ्रंट ऑफ द हाइलम, फिर बोल सकते हो द राइट फ्रेनिक नर्व गोज विथ आईवीसी, आईवीसी के साथ राइट फ्रेनिक नर्व जाती है, लेफ्ट फ्रेनिक नर्व pierces the diaphragm, pierces the diaphragm. अब ये कहाँ गया? Now it goes to the abdomen, and it goes to the abdomen. Fine. So दोनों phrenic nerve enters the abdomen, supplies the abdomen from the inferior aspect. नीचे से abdominal side से diaphragm को supply करते हैं. So that's very important. So diaphragm पता है ना T8 पे क्या जाता है? देखो diaphragm T8 level पे क्या जाता है? IVC and right phrenic. Openings in the diaphragm. T10 पे कौन है? Esophagus with the vagus, right and left vagus. And T12 पे कौन है? Aorta, azygous vein and thoracic duct. So these are the openings in the diaphragm. ये right phrenic nerve है ना, वो IVC के साथ जाती है. The left phrenic nerve directly pierces the diaphragm and goes in the abdomen. Fine. It supplies the diaphragm from the abdominal aspect. So what are the openings in the diaphragm? ये भी मैंने आपको बोल दिया. T8 पे IVC with the right phrenic nerve, T10 पे esophagus with right and left vagus, and T12 पे aorta with the azygous vein and the thoracic duct. Fine. Intercostal nerve, intercostal space में होती है वो intercostal nerve. Accessory nerve, 11th cranial nerve, accessory nerve. What is the spinal accessory nerve supply? वैसे accessory nerve is of two types. One is spinal accessory, one is cranial accessory, right? The spinal accessory nerve दो muscles को supply करती है. Spinal accessory nerve दो muscles को supply करती है. नाम बताओ. Name the muscles. Spinal accessory nerve supplies two muscles. Name of the muscles. Any guesses? Name of the two muscles supplied by spinal accessory nerve. I'm waiting. मैं रुका हूँ आपके आंसर के लिए. बोलो. Name of the muscles supplied by spinal accessory nerve. Any guesses? Easy है. You should know this. ये आना चाहिए. This is very important. दो मसल जो स्पाइनल एक्सेसरी नर्व सप्लाई करती है. बोलो बच्चों, इजी है. हाँ, एक है ट्रोपीजियस, दूसरा है स्टर्नोक्लेडोमास्टॉइड, है ना. ट्रोपीजियस एंड स्टर्नोक्लेडोमास्टॉइड, दीज आर द टू मसल सप्लाइड बाय स्पाइनल एक्सेसरी नर्व. क्या लिखा आपने? सेराटस एंटीरियर नहीं है. अरे बच्चे, नहीं, स्केलेनस एंटीरियर नहीं है. क्या लिखा है? ट्रोपीजियस बराबर है. ट्रोपीजियस इज फाइन. अदिति, सेराटस नहीं है. इट्स स्टर्नोक्लेडोमास्टॉइड एंड ट्रोपीजियस, राइट. And this spinal accessory nerve is damaged in the posterior triangle. ये posterior triangle में बहुत सारे lymph nodes होते हैं. When we are removing the lymph node, the spinal accessory nerve gets damaged. अगर if the spinal accessory nerve is damaged in the posterior triangle of the neck, sternocleidomastoid को कुछ नहीं होता. Sternocleidomastoid is spared. It is intact. Muscle damages trapezius. The nerve first supplies the sternocleidomastoid. Understand? So समझो बच्चों, ये जो स्पाइनल एक्सेसरी नर्व है ना, फर्स्ट सप्लाइज द स्टर्नोक्लेडोमास्टॉइड, फिर वो पोस्टीरियर ट्रायंगल में आती है, फिर सप्लाइज द ट्रेपीजियस. तो अगर अपन पोस्टीरियर ट्रायंगल में डैमेज करते हैं, इफ द नर्व इज डैमेज्ड इन द पोस्टीरियर ट्रायंगल ऑफ द नेक, हु इज अफेक्टेड? ट्रेपीजियस. स्टर्नोक्लेडोमास्टॉइड इज हैप्पी, इंटैक्ट है ये. इट इज इंटैक्ट. समझ में आ रहा है ये? अ वेरी इंपॉर्टेंट एमसीक्यू. Damage to the spinal accessory nerve in the posterior triangle of the neck results in paralysis of trapezius. Sternocleidomastoid को कुछ नहीं होता. समझ में आया ये? समझ में आया? विंगिंग नहीं है रे बच्चे, विंगिंग नहीं है निखिल. विंगिंग ऑफ स्कैपुला इज ड्यू टू इंजरी टू द लॉन्ग थोरैसिक नर्व है बच्चे. सेराटस एंटीरियर अलग है. हाँ, विंगिंग ऑफ स्कैपुला, हाँ, ट्रेपीजियस पैरालाइज होता है तो विंगिंग ऑफ स्कैपुला एट रेस्ट. हाँ, सॉरी. And winging of scapula on attempt on on attempting movement. Winging of scapula on attempting movement is serratus anterior paralysis. Winging of scapula at rest is trapezius. ठीक है बच्चों, क्लियर है? हाँ, 2-3 MCQs मैंने अभी बोला आपको. If you understood that. हाँ, 2-3 MCQs अभी खत्म किए हमने, है ना. So everything is correlated. एक चीज समझोगे ना, the rest thing automatically follows, right? So which muscle forms the floor of cubital fossa? बोल सकते हो? Which are the two muscles which forms the floor of cubital fossa? Yes, floor of cubital fossa. Answer this. Which muscle forms the floor of cubital fossa? That's the head of the radius, that's the neck of the radius, that's a radial tuberosity. यह है shaft of यह है shaft of the radius, that's a ulna, and that's a ulnar tube. क्या हो रहा है ये? And that's a ulnar tuberosity. Fine है बच्चे. Now which is this muscle inserted on the ulnar tuberosity? Ulnar tuberosity पे एक muscle inserted होता है, and which is this muscle which begins from the ulna? ये ulna से arise होता है. It goes behind the radius and comes and gets inserted on the lateral aspect of the radius. ये कौन है? Supinator. And what is this muscle? That's a brachialis. Supinator and brachialis. This is going to form the cubital fossa. ये बनता है cubital fossa. So cubital fossa का floor is formed by what? The brachialis and the supinator. Very good, Nikhil. Brachialis and supinator बनाते हैं floor of cubital fossa. Brachialis and supinator. ठीक है? And what are the boundaries बोल सकते हो? ये कौन है? That's the pronator teres. That's the brachioradialis. And the base is formed by the imaginary line joining the two epicondyles. So this is the pronator teres. That's the brachioradialis. And the base is formed by the imaginary line joining the two epicondyles. Contents of cubital fossa बोल सकते हो medial to lateral. That's a medial nerve. हाँ, brachial medial nerve, brachial artery, the biceps tendon, and the radial nerve. That's MBBR from medial to lateral. ठीक है, medial to lateral, it's medial nerve, brachial artery, tendon of biceps, and the radial nerve. That becomes the contents. MBBR. MBBR है बच्चे, MBBR है निखिल. ठीक है, परफेक्ट परफेक्ट परफेक्ट, वेरी गुड, बहुत बढ़िया बहुत बढ़िया. तो इसमें आंसर क्या होगा? इसमें आंसर है ब्रेकियालिस. ब्रेकियालिस. बट देयर आर टू मसल्स, दो मसल्स होते हैं विच फॉर्म्स द फ्लोर ऑफ क्यूबाइटल फोसा. एक है ब्रेकियालिस, दूसरा है सुपाइनेटर. ब्रेकियालिस एंड सुपाइनेटर, ये दो क्या बनाते हैं? बाउंड्रीज. दिस टू आर गोइंग टू फॉर्म द बाउंड्रीज. दिस फॉर्म्स द कंटेंट ऑफ द क्यूबाइटल फोसा. बाइसेप्स इज द कंटेंट, दिस आर द बाउंड्रीज. ब्रेकियालिस इज द फ्लो. ठीक है, ओके. Which cranial nerve provides parasympathetic supply to the parotid gland? Superficial branch of radial nerve. That's fine. Fine. Superficial branch is fine. Which cranial nerve provides parasympathetic supply to the parotid gland? Any guesses? Which nerve supplies parasympathetic supply to the parotid gland? Any guesses? Chalo, come on students, come on, be active, come on, answer, be active, answer. वो कौन सी नर्व है जो पैरासिम्पैथेटिक नर्व सप्लाई प्रोवाइड करती है पैरोटिड ग्लैंड के लिए? यस, दैट्स अ ग्लॉसोफैरिंजियल नर्व. ग्लॉसोफैरिंजियल नर्व, ग्लॉसोफैरिंजियल नर्व. यस, वेरी गुड. सो ग्लॉसोफैरिंजियल नर्व सप्लाइज द पैरोटिड ग्लैंड. बच्चों बोल सकते हो व्हाट इज द नेम ऑफ द न्यूक्लियस? मतलब ग्लॉसोफैरिंजियल नर्व का एक स्पेसिफिक न्यूक्लियस है to supply the parotid gland. What is the name of the nucleus of the glossopharyngeal nerve to supply the parotid gland? Anyone? बोल सकते हो what is the name of the nucleus of the glossopharyngeal nerve to supply the parotid gland? इसका नाम है, anyone? इसका नाम है inferior salivatory nucleus. So inferior salivatory nucleus है ना? हाँ, inferior salivatory nucleus है, that is the nucleus of the glossopharyngeal nerve जो parotid को supply करेगा. Okay, what about the facial? Facial nerve supplies all the glands in the head and neck, in the head, face and neck, except parotid. Except parotid, all the glands are supplied by facial nerve. ठीक है, मतलब all the glands का मतलब क्या है? Lacrimal, nasal, palatine, pharyngeal, submandibular, sublingual. Lacrimal, nasal, palatine, pharyngeal, submandibular, sublingual. ये होता है all the glands. So all the glands in the head and neck are supplied by हाँ, are supplied by facial nerve except parotid. Parotid को कौन supply करता है? Glossopharyngeal nerve. Right, excellent, very good. Now name of the nucleus. इसका nucleus का नाम बता सकते हैं? What is the name of the nucleus? Superior salivatory nucleus and lacrimatory nucleus. Superior salivatory and lacrimatory nucleus facial nerve का nucleus है जो सारे glands को supply करेगा. Vagus. Vagus supplies which gland? Vagus supplies the glands of GIT. Glands of GIT. And what is the name of the nucleus? इसका नाम है dorsal nucleus of vagus. Dorsal nucleus of vagus. बस इतना याद रखो. बस इतना ही याद रखो. So vagus has to supply the glands of GIT. What is the name of the nucleus of vagus जो glands of GIT को supply करेंगे? That's the dorsal nucleus of vagus. The name of the nucleus of glossopharyngeal nerve जो parotid को supply करेगा, inferior salivatory nucleus. And the name of the nucleus of facial nerve which is going to supply all the glands, that's the superior salivatory and lacrimatory nucleus. Okay, just remember this. हाँ, ये बहुत important है बच्चों, याद रखना. Very simple way I've told you this. बस इतना याद रखना. Just remember this much. Fine? Great. Very nice. Very nice. Come on. Going to the next MCQ. A patient had loss of sensations in the first dorsal web space between the great toe and the second toe with weak toe extension. Which nerve is likely to be injured? Any guesses for this? Any guesses? समझ में आ रहा है ना बच्चों सबको? Everyone is fine, understanding? हाँ, कुछ doubts है तो पूछना. हाँ, if you have any doubts you ask me. Answer is deep peroneal nerve. Very good. Answer is deep peroneal nerve. I'll draw the slide. ये slide draw करता हूँ. इसको याद रखिए. That's the great toe. These are the fingers. That's a foot. ये foot मैंने draw किया. Sole है. ये sole of the foot है. Sole. हाँ, sole of the foot. Tell me. Who supplies the medial aspect of the foot up to the great toe? Who supplies this? Saphenous nerve. So who supplies the skin of the medial aspect of the foot up to the great toe? That's saphenous nerve. Who supplies the skin on the medial aspect of the great toe? This is the superficial peroneal nerve. Superficial peroneal nerve supplies the skin on the medial aspect of the great toe. All the web spaces, ये समझते हो web spaces of the foot. This is supplied by superficial peroneal nerve. Superficial peroneal nerve. The first web space, ये the first web space जहाँ पे slippers पहनते हो, this is supplied by deep peroneal nerve. So the first web space जहाँ पे अपन slippers पहनते हैं, we put slippers, that is supplied by the deep peroneal nerve. Okay. The skin on the lateral aspect of the foot, this is supplied by sural nerve. And sural is a branch of tibial nerve. ये tibial nerve का branch है. The heel is supplied by tibial nerve. Now this 3.5 fingers is supplied by medial plantar nerve. Medial plantar nerve. And this 1.5 fingers is supplied by lateral plantar nerve. Lateral plantar nerve. Medial and lateral plantar nerves are branches of tibial nerve. ये tibial nerve की branch है. This is the complete nerve supply of the foot. Sole है, ये sole है. That's the sole of the foot. So the heel is supplied by whom? Tibial nerve. 3.5 fingers, medial plantar nerve. 1.5 fingers, lateral plantar nerve. ये दोनों tibial nerve के branches होते हैं. Medial aspect of the foot up to the great toe, saphenous nerve. Medial aspect of the great toe, superficial peroneal. All the web spaces, superficial peroneal. First web space, deep peroneal. Lateral aspect, sural nerve. इस पे बहुत MCQs है. Just remember this. Plenty of MCQs on this, so just remember this. Okay, we go to the next MCQ. Which ligament connects the dense. So answer for this was what? Answer for this is deep peroneal now. Deep peroneal. ठीक है बच्चों? Okay, coming to the next MCQ. Which ligament connects the dens of the axis to the anterior arch of atlas? Yes, anyone? This is the anterior arch of atlas, and this is the odontoid process of dens. That's the odontoid process of dens. That's the odontoid process, or the dens. That's the second cervical vertebrae. Now, which ligament connects the odontoid process to the anterior arch of atlas? क्या लगता है आपको? What is that? एक लिगामेंट होता है यहाँ पे ऐसे. This is A. A. That's a transverse ligament of dens. The transverse ligament of dens is going to keep the dens attached to this atlas. This is the atlas. Arch. That's the arch of atlas. That's the odontoid process. From the tip of the dens, what is this? Apical ligament of dens begins from the tip of the dens, and एक X-shaped ligament होता है यहाँ पे. This is what we call as the cruciate ligament. Cruciate ligament, which keeps the dens in its position. But ये clivus को attached होता है. वो यहाँ पे attached नहीं है. It's attached to the clivus. ऊपर होता है clivus पे. So answer for this is the transverse ligament of dens. Transverse ligament. अपाइकल नहीं है बच्चे. अपाइकल लिगामेंट कनेक्ट्स द टिप ऑफ द डेंस टू द क्लाइवस. क्लाइवस जो स्लोप होता है ना फोरामेन मैग्नम के अंदर जाता है ना, द टिप एंटर्स इनटू द फोरामेन मैग्नम, मतलब फोरामेन मैग्नम के अंदर जाता है टिप ऑफ द डेंस, एंड टिप ऑफ द डेंस पे एक लिगामेंट होता है व्हिच इज नोन एज द अपाइकल लिगामेंट ऑफ डेंस व्हिच इज अटैच्ड टू द क्लाइवस. वो स्कल को अटैच्ड होता है, व्हिच इज द लिगामेंट व्हिच कनेक्ट्स. ये क्रूशिएट लिगामेंट भी है ना, इट इज अटैच्ड टू. Okay, this cruciate ligament is also attached inside the skull. ये skull के अंदर होता है. Apical ligament and cruciate ligament ये skull के अंदर होते हैं. Whereas first and second cervical vertebrae को it's the transverse ligament of dens. ये याद रखना. Answer is transverse ligament of dens. What is alar ligament? Alar ligament होता है which begins from the dens and goes like this. ये है alar ligament. ये एलार लिगामेंट क्या करता है? फ्रॉम द टिप ऑफ द डेंस ये साइड्स पे जाता है. इट डिवाइड्स द फोरामेन मैग्नम इनटू टू पार्ट्स. फोरामेन मैग्नम इनटू टू पार्ट्स. एक मिनट, आई जस्ट ड्रॉ दिस फॉर यू. लुक, दैट्स द स्कल. नहीं, ये आई कैन नॉट ड्रॉ इट लाइक दिस. ये मैं फोरामेन मैग्नम, ये मैं क्लाइवस ड्रॉ करता हूँ. क्लाइवस, हाँ, दैट्स द फोरामेन मैग्नम. दैट्स द फोरामेन मैग्नम. व्हाट एंटर्स इनटू दिस फोरामेन मैग्नम is the tip of the dens. That's a tip of the dens. That's a dens. This is the arch of atlas. ये atlas है. हाँ, अभी समझ लो. ये है atlas vertebrae. Atlas. हाँ, ये है arch of atlas. This is the odontoid process जो अंदर गया. ये जो slope है ना, इसको बोलते हैं clivus. ये slope को बोलते हैं clivus. ये skull के अंदर है. So, what is this ligament? Yeah, that's a apical. So now, what is this ligament? ये जो ligament है ना, इसका नाम है apical ligament. Apical ligament of dens. Then there's an X-shaped ligament here. इसका नाम है cruciate ligament. Cruciate ligament. ये skull के अंदर है. This is attached inside the skull to the clivus. And यहाँ पे एक ligament है. Like this. This is the transverse ligament. So the transverse ligament holds the odontoid process to the anterior arch of atlas. ये transverse ligament है. बाकी apical ligament, ये cruciate ligament, ये सब skull के अंदर है. They are inside the skull. I hope this is clear. Is this clear to all of you? Fine. So answer for this is transverse ligament of atlas. Okay, just remember that. Coming to the next MCQ, a fall on outstretched hand. Fall on outstretched hand causes weakness of OK sign. Okay. inability to flex the thumb, interphalangeal joints, and index distal interphalangeal joints. Which nerve branch is damaged? Okay sign. Answer this. So flexion of thumb is lost and interphalangeal joints of this index finger is lost. So which nerve is that? So flexion of the thumb कौन करता है? Flexion of thumb is done by flexor pollicis longus, and flexion of distal interphalangeal joint of index finger is done by flexor digitorum profundus. Flexor digitorum profundus. Both this are supplied by, ये दोनों को कौन सप्लाई करता है? Anterior intraosseous nerve. Both this are supplied by anterior intraosseous nerve, and this anterior intraosseous nerve is a branch of median nerve. It's a branch of median nerve, right? So flexion of the thumb is done by flexor pollicis longus. The flexion of the distal interphalangeal joint is done by flexor digitorum profundus, and these two muscles are supplied by anterior intraosseous nerve. This is supplied by, दिख नहीं रहा है, anterior intraosseous nerve, which is a branch of the median nerve. It's a deep branch of median nerve. So the deep branch of recurrent branch nahi hai, it's the anterior intraosseous nerve. बच्चे, anterior intraosseous nerve is given in the forearm. Anterior intraosseous nerve is a deep branch of median nerve given in the forearm, and ये anterior intraosseous nerve क्या supply करता है? The flexor pollicis longus. It supplies the flexor digitorum profundus का lateral half. It supplies the pronator quadratus. ये तीनों muscles, better these three muscles in the forearm. Anterior intraosseous nerve is a deep branch of median nerve given in the forearm. The recurrent branch of median nerve is given in the hand. ये thenar muscles को supply करती है. Recurrent branch of median nerve है ना बच्चा? It is given in the hand. It supplies the muscles of thenar eminence. तो सवाल ही नहीं इसका सवाल ही नहीं. So answer is anterior intraosseous nerve. आपको पता है मीडियन नर्व है, आपको पता है मीडियन नर्व है, बट यू आर कंफ्यूज्ड बिटवीन व्हाट? द रिकरेंट ब्रांच ऑफ मीडियन और द एंटीरियर इंट्रोजस नर्व. नाउ जस्ट ट्राई टू अंडरस्टैंड. रिकरेंट ब्रांच ऑफ मीडियन नर्व इज गिवन इन द हैंड. इट सप्लाइज द मसल्स ऑफ thenar eminence, whereas ये जो मसल्स है ना, ये दिस इज प्रेजेंट इन द फोरआर्म. So in the forearm, which is a deep branch of median nerve, anterior introosseous nerve. समझ में आ रहा है बच्चों? Are you able to follow this? हाँ, समझ में आ रहा है? अगर नहीं समझ में आ रहा है तो let me know. If you're not able to follow, let me know. Posterior introosseous nerve is a branch of what? Radial nerve. This is a branch of radial nerve. Ulnar nerve is out of question. Yes, hello. Yes, Nikhil, Aditi, Keshav, Amit. हाँ, very good. Clear to all of you? Coffee. Yes, coffee. और कौन है? Very good बच्चों. You are all very nicely listening. Very good. Saqib. Yes. Ayush. Riyaj. Honeybee. चलो, great. Very nice. चलो, great. Excellent. Excellent. हाँ, ये याद रखना बच्चों. These are all very confusing MCQs and these are scoring MCQs. अगर आपको ये पता है, you will exceed the other students, है ना? चलो, which artery supplies the thyroid gland? Anyone? So there are three arteries which supply the thyroid gland. एक है अपना superior thyroid artery, एक है अपना inferior thyroid artery, and एक है अपना thyroid imma artery. So what is the answer for this? All of the above. All of the above. Right. So which artery supplies the thyroid gland? All of the above. Superior thyroid, inferior thyroid, thyroid imma. है ना बच्चे? Easy है. This is easy. अरे बच्चे, which artery supplies the thyroid gland? Answer is D. हाँ, D. Now you tell me. चलो. Now you tell me. हाँ, very good, very good. Now you tell me, superior thyroid artery is a branch of what? Superior thyroid artery is a branch of external carotid artery. The superior thyroid artery goes along with a nerve. What's the name of the nerve? Superior thyroid artery is a branch of external carotid. ये कौन से nerve के साथ जाती है? एक्सटर्नल लैरिंजियल नर्व के साथ ये जाती है. एक्सटर्नल लैरिंजियल नर्व goes with the superior thyroid artery. Inferior thyroid artery is a branch of thyrocervical trunk. Thyrocervical trunk, which is a branch of the subclavian artery. Thyrocervical trunk is a branch of first part of the subclavian artery. ये किसके साथ जाती है? Recurrent laryngeal nerve. It accompanies the recurrent laryngeal nerve. This you know. And thyroid imma is a branch of aorta. Is a direct branch of aorta. हाँ, ये आपको पता है. So superior thyroid artery is a branch of external carotid, goes along with the external laryngeal nerve. Inferior thyroid artery is a branch of thyrocervical trunk, which is a branch of the first part of subclavian artery, goes along with the recurrent laryngeal nerve. And thyroid imma is a branch of the aorta. Perfect. Very good, very good, very good. Excellent. एक बोल सकते हो ब्रांचेस ऑफ एक्सटर्नल कैरोटिड बोल सकते हो, हमेशा पूछते हैं. ओके, या फिर ऐसे बोलो फर्स्ट ब्रांच ऑफ एक्सटर्नल कैरोटिड. चलो बच्चों, फर्स्ट ब्रांच ऑफ एक्सटर्नल कैरोटिड एक एमसीक्यू है. फर्स्ट एंटीरियर ब्रांच ऑफ एक्सटर्नल कैरोटिड, ये दूसरा एमसीक्यू है. आंसर, there are two different MCQs. First branch of external carotid, first anterior branch of external carotid. कौन है? बोल सकते हो? First branch of external carotid. First branch of external carotid artery, and दूसरा है first branch of external carotid artery and first anterior branch of external carotid artery. चलो बोलो. These are two different MCQs. हाँ, क्या बोल रहे हो? What are you saying? First anterior branch of external carotid is superior thyroid. Okay, superior thyroid. First anterior branch is superior thyroid. फिर आता lingual and आता facial. So first anterior branch is superior thyroid. उसके बाद आता lingual, उसके बाद आता facial. First branch of external carotid बोल सकते हो? हाँ. First branch of external carotid is the medial branch. That's the ascending pharyngeal. That's the medial branch. It's on the medial side. हाँ, मतलब anterior branches में पहली anterior branch is superior thyroid, दूसरा lingual, तीसरा facial. On the medial side, the first branch of external carotid is ascending pharyngeal. That's on the medial side. तो MCQ अगर आता है first branch, your answer is ascending pharyngeal. अगर MCQ आता है first, हाँ, हाय बच्चे, निखिल येवले, वेरी गुड, बहुत अच्छा कर रहे हो आप, बहुत अच्छा. हाँ हाँ अमित, वो सब ठीक है बच्चे. अमित, 3 branches from our anterior branches, but उसमें first branch is superior thyroid, फिर आता है lingual, फिर आता है facial. बट अगर एमसीक्यू आता है फर्स्ट ब्रांच ऑफ एक्सटर्नल कैरोटिड, मतलब फर्स्ट ब्रांच जो एक्सटर्नल कैरोटिड देगी, दैट इज ascending pharyngeal. That's on the medial side. Posterior branches is posterior auricular and occipital, and terminal branches is superior temporal and maxillary. ये आपको पता है. Terminal branches is superior temporal and maxillary. निखिल शेवाले, निखिल येवले. हाँ. Which part of the colon is retroperitoneal? Anyone? Which part of the colon is retroperitoneal? Very good, very good. हाँ बच्चे, Aditi, clear है ना? Aditi, first branch is ascending pharyngeal and first anterior branch is superior thyroid. Okay, answer this. Aditi, clear है बच्चे? So answer for this, इसका आंसर clear है ना? हाँ, okay, that is fine. ये ठीक था. चलो चलो चलो, come on, students, come on, answer. Come on. चलो बच्चों, last part of the MCQ is left. Have some energy, put in some efforts and answer. Which part of the colon is retroperitoneal? Ascending colon and descending colon are retroperitoneal. Okay, इसमें आंसर क्या होगा? Ascending colon. Ascending colon is retroperitoneal. Transverse colon is transverse mesocolon होता है उसका. Sigmoid colon को sigmoid mesocolon होता है. Cecum को भी peritoneum होता है. So retroperitoneal is ascending colon. Which are the other retroperitoneal organs बोल सकते हो? The list of retroperitoneal organs: kidneys, suprarenal, duodenum is retroperitoneal except a small area of the first and the fourth part. छोटा सा first part, छोटा सा fourth part का area is intraperitoneal. फिर आता है pancreas, फिर आता है ascending colon and descending colon. Ascending colon, descending colon, aorta and IVC and the ureters. That's retroperitoneal organs. बच्चे याद रखना, हमेशा पूछते हैं list of retroperitoneal organs: the kidneys, the suprarenal glands, the duodenum, the pancreas, the ascending descending colon, aorta, IVC and the ureters. This is the list of retroperitoneal organs. Fine. Okay, perfect, very good. बहुत अच्छे, बहुत अच्छे. Which nerve provides sensations to the medial aspect of the forearm? हाँ, medial aspect of the forearm. Answer this, ये easy है. Which nerve supplies sensations to the medial aspect of the forearm? Ha. Easy. That's a medial cutaneous nerve forearm. Medial cutaneous nerve forearm. Forearm is known as antebrachium. Brachium is arm, antebrachium is forearm. So that's a medial cutaneous nerve of forearm. Medial cutaneous nerve forearm. हाँ ठीक है बच्चे. Tail of pancreas is intraperitoneal. Very good. Very good Amit Monty. Very good, very nice. Answer is C for the C. B क्या लिखा? Ulnar nerve. अरे बच्चे, medial antebrachial cutaneous nerve is medial cutaneous nerve of forearm. Medial anti, ये ना antebrachium is forearm. Medial cutaneous nerve of forearm, ऐसे उसका आंसर है. It's a medial cutaneous nerve of forearm, which is a branch of brachial plexus. वो brachial plexus का branch है. Ulnar nerve नहीं supply करती है. Ulnar nerve does not supply the skin on the medial aspect of the forearm. No, it is the medial cutaneous nerve of forearm, which is a branch of brachial plexus, the branch of medial cord of the brachial plexus. The medial cutaneous nerve of arm, it's a branch of the medial cord of brachial plexus. So medial cutaneous nerve of arm, medial cutaneous nerve of forearm, ये है branch of medial cord of brachial plexus. ठीक है. Can anyone tell me who supplies the skin on the upper lateral aspect of the arm? Medial side ulnar nerve नहीं supply करते हैं बच्चे. अदिति, किसका medial side बोल रहे हो बच्चे? Aditi, medial side is not supplied by ulnar nerve. Medial side of forearm is supplied by the medial cutaneous nerve forearm, which is the branch of medial cord. Medial aspect of the arm is supplied by the medial cutaneous nerve arm, which is a branch of medial cord. Can anyone tell me who supplies the skin on the upper lateral aspect of the arm? Upper lateral aspect of the arm. हाँ, वो confusion के लिए दिया है ना बच्चे. वो confusion के लिए दिया है. Which is the nerve which supplies the skin on the upper lateral aspect of the arm? Anyone? Which is the nerve which supplies the skin on the upper lateral aspect of the arm? Nerve पूछ रहा हूँ, nerve पूछ रहा हूँ. Aditi, deltoid is also supplied by that nerve. Deltoid is also supplied by that nerve. That's the axillary nerve. Very good. So the axillary nerve supplies the deltoid, the teres minor, and gives a cutaneous branch. नाम है upper lateral cutaneous nerve of arm. If there's an injury to this nerve, ये बनता है regimen batch sign. याद रखना, very important. Regimen batch sign is due to lesions of axillary nerve. Axillary nerve. Yeah, ना, I've got an Instagram channel जिसपे I put small reels. PW का भी Instagram channel है, वो भी देख लो. I've got my own Instagram channel जिसपे छोटे वाइवा topics मैंने डाले हैं. Okay, just have a look at that. So सब वाइवा concepts will be cleared. Okay, fine. हाँ, ठीक है. Okay, all the following muscle forms the posterior wall of axilla. All the following muscle forms the posterior wall of axilla except. बोल सकते हो? The posterior wall of axilla is formed by anterior wall. बोल सकते हो? Anterior wall is formed by pectoralis major, pectoralis minor and subclavius. Anterior wall of axilla, pectoralis major, pectoralis minor, subclavius. ये है anterior wall. The posterior wall is formed by three muscles. The subscapular is the teres major and the latissimus dorsi. This three muscle forms the posterior wall of axilla. पहला subscapularis, फिर आता है teres major, फिर आता है latissimus dorsi. So these three muscles are going to form the posterior wall of axilla. The medial wall of axilla is formed by the ribs and the serratus anterior. Anterior wall of axilla कौन बनाता है? Pectoralis major and pectoralis minor. ठीक है, पेक्टोरलिस मेजर, पेक्टोरलिस माइनर एंड द सबक्लेवियस, ये क्या बनाते हैं? एंटीरियर वॉल ऑफ एक्सिला. द पोस्टीरियर वॉल ऑफ एक्सिला इज फॉर्म बाय सबस्कैपुलरिस नंबर 1, फिर आता है टेरिस मेजर नंबर 2 एंड सबसे नीचे आता है लैटिसिमस डॉर्सी. द मीडियल वॉल ऑफ द एक्सिला इज फॉर्म बाय द रिब्स एंड द सेराटस एंटीरियर एंड द लैटरल वॉल इज फॉर्म बाय ह्यूमरस. ओके, हाँ, वेरी गुड, एक्सलेंट, वेरी गुड बच्चों, वेरी गुड. Coming to the next, which extraocular muscle is innervated by abducens nerve? Easy hai. This is very easy. Very easy. All the extraocular muscles are supplied by third nerve. है ना? All the extraocular muscles are supplied by third nerve except LR, which is supplied by sixth nerve, and superior oblique, which is supplied by fourth nerve. So lateral rectus, which is abducens nerve. Abducens nerve would be lateral rectus. Lateral rectus is supplied by sixth nerve and superior oblique is supplied by fourth nerve. ठीक है? So lateral rectus is supplied by sixth nerve, superior oblique is supplied by fourth nerve. Rest all the muscles are supplied by third nerve. Third nerve. ठीक है? What else is the third nerve supply? Third nerve supplies all the extraocular muscles, all extraocular muscles except lateral rectus and superior oblique. It supplies the levator palpebrae superioris. It supplies the sphincter pupillae and ciliaris. Sphincter pupillae and ciliaris. ठीक है? So third nerve supplies all the extraocular muscles except the lateral rectus and superior oblique. It supplies the levator palpebrae superioris. It supplies the sphincter pupillae and ciliaris. अगर third nerve damage होता है तो क्या होता है? If the third nerve is damaged, all the extraocular muscles are paralyzed except lateral rectus and superior oblique. So lateral rectus will pull the eyeball laterally. Lateral rectus क्या करेगा? It will pull the eyeball laterally. This will result in, इससे क्या होगा? इससे होगा lateral squint. इससे होगा lateral squint, diplopia. Because of the fourth nerve से diplopia होगा, sixth nerve से lateral squint होगा. Levator palpebrae superioris paralyze हो गया तो ptosis होता है, ptosis, and the pupil is dilated. Pupil is dilated and fixed because the sphincter pupillae and ciliaris is damaged. ठीक है ना? ये याद रखना, this is very important. ये याद रखना. So अगर थर्ड नर्व इंजरी होती है तो क्या होता है? All extraocular muscles are paralyzed except lateral rectus and superior oblique. So lateral rectus will pull the eyeball laterally, उससे बनेगा lateral squint. Superior oblique will pull the eyeball down, तो उससे होगा diplopia. Levator palpebrae superioris is gone, so you get ptosis, and sphincter pupillae and ciliary is damaged, so the pupils are dilated and fixed. Okay, just remember this. So that is injury to the third nerve. Okay. Fine. So coming to the next, which nerve supplies the adductor muscles of the thigh? I've just told you this. मैंने अभी बोला आपको. Which is the nerve which supplies the adductor muscles? Adductor muscles is supplied by obturator nerve. Obturator nerve. Adductor muscles is supplied by obturator nerve. Obturator nerve के दो divisions होते हैं, anterior posterior division. Anterior division क्या supply करती है? I'll just again write this for you. So obturator nerve का anterior and posterior division है. Anterior division supplies the adductor longus, adductor brevis, gracialis and pectineus. Posterior division supplies the adductor magnus and the obturator externus. Obturator externus. Femoral nerve is a nerve of the anterior compartment of thigh. Anterior compartment के nerve है femoral. Sciatic nerve is a nerve of the posterior compartment. The lateral femoral cutaneous nerve of the thigh. ये जो lateral femoral cutaneous nerve है ना, last option. What does it supply? It supplies the skin on the lateral aspect of the thigh. And this lateral cutaneous nerve of the thigh gets compressed against the inguinal ligament. The person complains of paresthesia, tingling and numbness along the lateral aspect of the thigh. क्या बोलते हो उसको? What do you call this as? What do you call this as? This lateral femoral cutaneous nerve thigh gets compressed against the inguinal ligament. Patient क्या बोलेगा? Paresthesia, tingling and numbness along the lateral aspect of the thigh. इसे क्या बोलते हो? This is what we call as meralgia. Meralgia, M-E-R-E-L-G-A, meralgia paresthetica. Meralgia paresthetica. Meralgia paresthetica is the compression of, very good, Aditi, excellent. Meralgia paresthetica is the compression of the lateral cutaneous nerve of thigh against the inguinal ligament. Person will complain of paresthesia, tingling and numbness along the lateral aspect of the thigh. Perfect hai? Perfect hai? Okay. ग्रेट, वेरी गुड. हाँ, ये सब क्लियर है ना बच्चे? बी वेरी क्लियर अबाउट द लोअर लिम्ब के मसल्स, द नर्व सप्लाइंग द लोअर लिम्ब्स, ये सब याद रखना. वेरी गुड. चलो, ग्रेट, वेरी नाइस. यू आर ऑल आंसरिंग वेरी गुड. ऐसे ही पढ़ो, अच्छा रिजल्ट आएगा आपका. यू विल डेफिनेटली क्रैक द एग्जाम्स. फिर इंटरव्यू के लिए जरूर आना. विल टेक योर इंटरव्यू. ओके, चलो, आइडेंटिफाई दिस लेबल्ड स्लाइड्स. लेबल. चलो, हु इज दिस? ए कौन है? ए होगा क्लैविकल. ए है क्लैविकल. ये बी, व्हाट्स दिस? बी कोरोकॉइड प्रोसेस. ये है कोरोकॉइड प्रोसेस ऑफ स्कैपुला. व्हाट्स सी? सी है अपना स्कैपुला, सुपीरियर बॉर्डर ऑफ स्कैपुला वो. व्हाट्स डी? डी इज द acromion process. So what is the answer for this? Clavicle, coracoid process, scapula, acromion. Answer is this, B. ठीक है बच्चों, आंसर इज बी फॉर दिस. क्लियर है? सो ए इज क्लैविकल. ए क्लैविकल है, बी है कोरोकॉइड प्रोसेस, सी है स्कैपुला, डी इज एक्रोमियन प्रोसेस. ठीक है ना? इजी है. आंसर इज बी फॉर दिस. बी लिखा है ना आपने? हाँ. हे बच्चों, कैन यू आंसर कोरोकॉइड प्रोसेस ऑफ स्कैपुला? व्हाट इज द टाइप ऑफ एपिफाइसिस? कम ऑन, बहुत इंपॉर्टेंट है. कोरोकॉइड प्रोसेस ऑफ स्कैपुला, व्हाट इज द टाइप ऑफ एपिफाइसिस? चलो, टेक दिस क्वेश्चन, वेरी इंपॉर्टेंट. आंसर करो. कोरोकॉइड प्रोसेस ऑफ स्कैपुला, व्हाट इज द टाइप ऑफ एपिफाइसिस? यस बच्चों, क्रैक करो क्वेश्चन. क्रैक दिस क्वेश्चन. Coracoid process of scapula, the type of epiphysis. Any guesses? हाँ, atavistic aberrant नहीं बच्चे, atavistic epiphysis. Aberrant is an extra epiphysis. Aditi, aberrant मतलब extra epiphysis. Yes, Nehar, very good. It's atavistic epiphysis. Atavistic epiphysis is coracoid process of scapula. Ostrigonum of talus, ये है atavistic epiphysis. समझ में आया? aberrant मतलब extra epiphysis. The proximal end of the first metacarpal bone is an aberrant epiphysis. फिर बाकी epiphysis पता है ना आपको? traction epiphysis. एग्जाम्पल बोलो. एग्जाम्पल ऑफ ट्रैक्शन epiphysis. 4 टाइप्स ऑफ epiphysis है, याद रखना बच्चे. दिस इज ऑलवेज आस्क्ड इन द एग्जाम. एक है प्रेशर epiphysis. हाँ, दूसरा है ट्रैक्शन एपिफाइसिस, तीसरा है एटाविस्टिक एंड चौथा है एबरेंट. हाँ बोलो. हाँ, so pressure epiphysis, ends of long bones. Simple है, ends of long bones which are subjected to pressure. Example, the head of the humerus, the condyles of femur, है ना? Ends of long bones, याद रखना. So that is pressure epiphysis. Traction epiphysis बोलो. The epiphysis which is formed due to pull of the muscles, the muscle pull. Example is tubercles of humerus, trochanterus of femur, mastoid process, tibial tuberosity. That's traction. जो भी pull से बनता है, that's traction epiphysis. हाँ, ठीक है. हाँ, ये टाइप्स बोल रहा हूँ. एटाविस्टिक एपिफाइसिस क्या है? इट इज फंक्शनल इन लोअर एनिमल्स, डीजनरेटेड इन ह्यूमंस. लोअर एनिमल्स में ये सेपरेट बोन होता है. इट इज डीजनरेटेड इन ह्यूमंस. एग्जांपल इज कोरोकॉइड प्रोसेस ऑफ स्कैपुला, ऑस्ट्राइगोनम ऑफ टैलस. And the last one is aberrant. Aberrant matlab extra, additional epiphysis, extra epiphysis. Example is the proximal end of the first metacarpal bone. Proximal end of the first metacarpal bone is an example of aberrant epiphysis. ठीक है, याद रखोगे? हाँ, दिस आर द टाइप्स ऑफ एपिफाइसिस, याद रखना बहुत इंपॉर्टेंट है. फाइन है, फाइन अदिति, फाइन निखिल. हाँ, वेरी गुड वेरी गुड. ऐसे ना रिवाइज करते रहो, रिवाइज करो, डिस्कस विद योर फ्रेंड्स. हाँ, इट विल बी क्लियर. चलो, विच लिगामेंट कनेक्ट्स द लीवर टू द एंटीरियर एब्डोमिनल वॉल? बोल सकते हो? द लिगामेंट विच कवर्स द लीवर टू द एंटीरियर एब्डोमिनल वॉल. चलो, आई टेल यू दिस, ये मैं बोलता हूँ आपको. लुक, व्हाट आर द कंटेंट्स ऑफ अम्बिलिकल कॉर्ड? ये फटाफट फटाफट बोल दो. व्हाट आर द कंटेंट्स ऑफ अम्बिलिकल कॉर्ड? इसमें 2 अम्बिलिकल आर्टरीज होती है एंड 1 अम्बिलिकल वेन होता है. देयर आर 2 अम्बिलिकल आर्टरीज एंड 1 अम्बिलिकल वेन. दिस वेन is the left umbilical vein. This left umbilical vein goes and joins with, ये कौन है अपना? That's the liver here, and in the liver we have this portal vein. That's the portal vein. That's the left branch of portal vein. So the left umbilical vein goes and joins with the left branch of portal vein. Left umbilical vein. So that's the left umbilical vein. It goes and joins with the left branch of portal vein. अब left umbilical vein कहाँ से आती है? It comes from the placenta. Placenta से आती है. So if this pure blood goes to the portal vein से liver में जाएगा. The liver will use all this pure blood for its metabolism. हाँ, so the blood should not enter the liver. All the blood should not enter the liver. That's the IVC. यहाँ पे एक बाईपास होता है फ्रॉम द लेफ्ट ब्रांच ऑफ पोर्टल वेन टू द आईवीसी. इसे हम बोलते हैं डक्टस वेनोसिस. आई एम टेलिंग यू फीटल सर्कुलेशन बच्चा, फीटल सर्कुलेशन बहुत इंपॉर्टेंट है ये. फीटल सर्कुलेशन याद रखना. सो contents of umbilical cord, there are 2 umbilical arteries and the left umbilical vein. The left umbilical vein placenta से आती है. It goes to the left branch of portal vein. From the left branch of portal vein, एक bypass is there to the IVC. That's the ductus venosus. From the IVC, blood goes to the right atrium. Right atrium से the blood goes to the left atrium through the foramen ovale. Foramen ovale से the blood goes to the left atrium. Left atrium से left ventricle. Left ventricle से aorta. Aorta divides into 2. Aorta divides into 2 common iliacs. Common iliacs divides into an external and internal iliac. External iliac. Okay, so external and internal iliac. From the internal iliac, these are the umbilical arteries. So these are the umbilical arteries. Umbilical arteries are branches of internal iliac. Aorta divides into common iliacs. Common iliacs divides into external, internal. Internal iliac के ये 2 branches है. These are the umbilical arteries. So umbilical arteries are branches of internal iliac. हाँ, क्या बी ऑप्शन में 1 मिनट. आई विल टेल यू दैट. मैं बोलता हूँ, डोंट वरी, मैं बोलता हूँ. वेट. So from the right atrium, suppose the blood goes to the right ventricle. Right ventricle से ये pulmonary trunk में जाएगा. Pulmonary trunk से lungs में जाएगा. The lungs are not functioning, बच्चे, the lungs are not functioning. So the blood should not go to the lungs. तो ये aorta को जाता है. This is the ductus arteriosus. ये है ductus arteriosus. ये है अपना fetal circulation. ये याद रखना बहुत 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 important है. एक बार वापस बोलता हूँ. Look, the left umbilical vein carries the blood to the left branch of portal vein. Left branch of portal vein से ductus venosus IVC लेके जाता है. From the IVC, blood goes to the right atrium. Right atrium से सीधे left atrium में foramen ovale. Left atrium, left ventricle, aorta, common iliacs, internal iliacs से the impure blood goes to the umbilical artery to the placenta. सपोज अगर ब्लड राइट एट्रियम से राइट वेंट्रिकल में गया, राइट वेंट्रिकल से पल्मी ट्रंक में गया, पल्मी ट्रंक से लंग्स में जाएगा, बट द लंग्स आर नॉट फंक्शनिंग, सो देयर इज अ बाईपास फ्रॉम द पल्मी ट्रंक टू द एओर्टा. दैट्स द डक्टस आर्टेरियोसिस. अब दिस इज द यूरिनरी ब्लैडर. यहाँ पे एक यूरिनरी ब्लैडर होगा. हाँ, यूरिनरी ब्लैडर. सो दिस अम्बिलिकल आर्टरीज दोनों तरफ से जाते हैं, यूरिनरी ब्लैडर को क्रॉस करते हुए अम्बिलिकस की तरफ जाते हैं. Now tell me what happens after birth. After birth क्या होता है? हाँ, after birth. I'll just write it here. After birth, the left umbilical vein is gone, and ये बनता है ligamentum teres. This ligamentum teres is present in the falciform ligament. Falciform ligament के अंदर होता है ये ligamentum teres. What is ligamentum teres? It is the obliterated left umbilical vein, and this ligamentum teres is present in the falciform ligament. Falciform ligament में होता है. Ductus venosus goes off, इसका बनता है ligamentum venosum. Ductus venosus का बना ligamentum venosum. फोरामेन ओवल बंद होता है, इट बिकम्स द फोसा ओवालिस. फोसा ओवालिस. डक्टस आर्टेरियोसस गोज ऑफ, इट बिकम्स द लिगामेंटम आर्टेरियोसम. वो बनता है लिगामेंटम आर्टेरियोसम. एंड दिस मच पार्ट ऑफ umbilical artery is gone. This much part of the umbilical artery obliterates. This is the obliterated umbilical artery. ये अब बनेगा this becomes the medial umbilical ligament. This becomes the medial umbilical ligament. ये बनेगा medial umbilical ligament. And this part of the umbilical artery remains patent. अब ये बनेगा अपना superior vesical artery. This becomes a superior vesical artery. So superior vesical artery is the non-obliterated part of umbilical artery. Non-obliterated part of umbilical artery. It extends from the internal iliac to the bladder. ये है fetal circulation. याद रखना. That's fetal circulation. Fine. So क्या बोल रहे थे बच्चे? ये previous वाला बोल रहे थे क्या? ये आंसर B है बच्चे. This is answer B. इसका आंसर B है. What is the answer for this? Which ligament connects the lever to the anterior abdominal wall? Answer is falciform ligament. Falciform ligament. And falciform ligament के अंदर कौन है? Meckel's क्या है बच्चे? Meckel's diverticulum is different रे बच्चे. Meckel's diverticulum is different. Okay, falciform ligament के अंदर क्या होता है? That's ligamentum teres. इसके अंदर होता है ligamentum teres. Falciform ligament के अंदर होता है ligamentum teres. And what is ligamentum teres? It is the obliterated left umbilical vein. Ligamentum teres is the obliterated left umbilical vein. याद रखना. Hepatoduodenal ligament. This is the lesser omentum. यही है lesser omentum. And round ligament of lever is the falciform ligament. वही है. Round ligament is the falciform ligament. Same. Coronary ligament is the one which holds the lever to the diaphragm. Diaphragm को वो connect करता है. That's coronary ligament. बच्चे clear है? समझ में आ रहा है ये? Is this fine to all of you? हाँ. Round ligament and that is the same thing. Falciform ligament, round ligament of lever is the ligamentum teres. Same ही है वो. There's nothing like separate round ligament. Which part of the sacrum articulates with the ilium to form the sacroiliac joint? Anyone? Anyone? Which part of the sacrum articulates with the ilium? So that's the ala of the sacrum. Ala is the lateral side of the sacrum. The ala of the sacrum, जो lateral side of the sacrum है, that articulates with the ilium to form the sacroiliac joint. Sacroiliac joint, what is the type of joint? Sacroiliac joint is a sacroiliac joint. It's a cartilaginous joint. Cartilaginous joint. Fine. You tell me what are the relations of the ala of sacrum? Relations of ala of sacrum. Relations of ala of sacrum. इसको याद रखना. SLIO. Sequences medial to lateral. What is ala of sacrum? पता है ना? Look, ये जो sacrum है ना ऐसे, that's a sacrum. And ये जो है ना ये, this is the ala. ये है ala of the sacrum. This part. इसको बोलते हैं ala of the sacrum. What are the relations of the ala of sacrum? SLIO. What is S? S is sympathetic chain. L is the lumbosacral trunk. Lumbosacral trunk. I is the iliolumbar artery. O is the obturator nerve. O is the obturator nerve. ये याद रखना. So relations of the ala of the sacrum, medial to lateral, the sympathetic chain, L is the lumbosacral trunk, I is the iliolumbar artery, and O is the obturator nerve. O होता है obturator nerve. Fine. So this becomes the relations of the ala of the sacrum. Bachcho, just remember that. Fine to all of you. Okay. Is this clear? Perfect. We'll go ahead. A fracture of surgical neck of humerus is most likely to injure which nerve? Chalo, answer this. This is easy. Surgical neck of the humerus. Which nerve is injured? Come on, students. Thoda sa baki hai. Some last 4-5 MCQs are left. Come on, put an energy and answer. Yes, fracture of the surgical neck. Which is the nerve which winds around the surgical neck of the humerus? Answer is axillary nerve. And axillary nerve क्या supply करती है? Axillary nerve supplies deltoid. Deltoid. दूसरा teres minor. Teres minor. So axillary nerve supplies the deltoid teres minor. वो एक cutaneous branch देती है जिसका नाम है upper lateral cutaneous nerve of arm. Upper lateral cutaneous nerve of arm. Injury to this nerve leads to regimen patch sign. So axillary nerve supplies the deltoid teres minor, एक cutaneous branch देती है जिसका नाम है upper lateral cutaneous nerve of arm. Injury to this nerve leads to regimen batch sign. ठीक है. Musculocutaneous nerve क्या supply करती है? Can you answer this? Musculocutaneous nerve supplies the biceps brachii, brachialis and coracobrachialis. Musculocutaneous nerve supplies the biceps brachii, the coracobrachialis and the brachialis and gives a cutaneous branch. जिसका नाम है lateral cutaneous nerve of forearm. So lateral cutaneous nerve of forearm is a branch of musculocutaneous nerve. It's a branch of musculocutaneous nerve. So musculocutaneous nerve supply क्या करती है? Musculocutaneous nerve supplies the biceps, the brachialis, the coracobrachialis and a cutaneous branch देती है, that is the lateral cutaneous nerve of forearm. The lateral cutaneous nerve of forearm, that's a branch of musculocutaneous nerve. Fine. बाकी radial nerve, ulnar, medial nerve, you must be knowing. Fine. Coming to the next slide. Answer this. A person came in with difficulty to abduct his left arm above 15 degrees and loss of sensations on the left lateral. Abhi bolo. X-ray shows X-ray of the affected arm is given. Which structure is most probably affected? Answer this. If you understand this and loss of sensations on the upper lateral aspect of the arm, that is regimen batch sign. So which nerve is affected? Axillary nerve. Axillary nerve is affected. ठीक है. Now tell me abduction at the shoulder joint. Abduction 0 to 15 degrees is done by whom? Supraspinatus. Abduction at the shoulder joint 0 to 15 degrees supraspinatus. 15 to 90 degrees is deltoid and 90 and above. 90 and above is done by serratus anterior, trapezius and lateral rotation of scapula. Lateral rotation of scapula. So abduction at shoulder joint 0 to 15 is supraspinatus, 15 to 90 is deltoid, 90 and above is done by serratus anterior, trapezius and the lateral rotation of scapula. ठीक है. So answer is axillary nerve, surgical neck of the humerus. What winds is the axillary nerve. हाँ, ये ठीक है ना? आप ये देखोगे तो you'll be able to answer that. Easy है. Come to the next MCQ. Which structure passes through the foramen spinosum? चलो answer this बच्चों. ये बहुत easy है. Foramen spinosum से which is the structure which goes out through the foramen spinosum? Middle meningeal artery and Yes, yes. Middle meningeal artery and the nervus spinosus. Nervus spinosus is the recurrent branch of mandibular nerve. The recurrent branch of mandibular nerve is known as the nervus spinosus. It is also known as the meningeal branch of mandibular nerve. Meningeal branch of mandibular nerve. Maxillary nerve कौन से foramen से जाती है? Maxillary nerve goes to foramen rotundum. Foramen rotundum से maxillary nerve जाती है. Mandibular nerve goes to foramen ovale. ओके, फोरामेन ओवेल से क्या क्या जाता है? फोरामेन ओवेल इज MALE. M इज मैंडिबुलर नर्व, A इज एक्सेसरी मेनिंजियल आर्टरी, L is the lesser petrosal nerve, and E is emissary vein. Okay, fine. Male. Very good. Nikhil is answering very well. Avinash Gupta, Snehar, very good. Sai, very good. सब लोग आंसर करो. Coming to the last, some MCQs are left. Yes, Aditi is answering. Very good. Chalo, answer then next. Which nerve is at risk during biopsy of an enlarged lymph node in the posterior triangle of the neck? चलो, ये मैं बोल रहा था आपको. This is what I was telling you. Which is the nerve which is damaged? Can anyone tell me this? This is a slide which I love to draw. Okay. चलो, तो अभी ये कौन है? That's it. Chabi. Oh, ये क्या हो गया? Now you tell me. One moment. Now you tell me. That's a mastoid process. That's a sternocleidomastoid. ये है trapezius. That's the mandible. This is the clavicle. यहाँ पे एक मसल होता है जिसका नाम है, एक मसल है जिसका नाम है levator scapulae. That's a posterior triangle of the neck, है ना? ये posterior triangle of the neck है. I was telling you this. In this posterior triangle of the neck, ये muscle है spinal accessory. On this lies the this muscle is levator scapulae. On this lies the spinal accessory nerve. Okay. So which nerve is at risk during biopsy of the lymph node? यहाँ पे बहुत सारे lymph nodes होते हैं. So which nerve, while removing the lymph node, which nerve is damaged? The spinal accessory nerve. अभी वापस मैं बोलता हूँ, damage to the spinal accessory nerve. अगर हम यहाँ पे damage करते हैं, damage to the spinal accessory nerve in the posterior triangle of the neck, which muscle would be paralyzed? ये मैं बोल रहा था आपको. Answer this. Which muscle would be paralyzed if the spinal accessory nerve, lymph nodes आप निकाल रहे हो, spinal accessory nerve damage हो जाती है, so which muscle is paralyzed? ये मैं बोल रहा था आपको. Come on students, answer. Which muscle is paralyzed? Yes, बोलो, I'm waiting. Hey, बोलो. Which muscle is paralyzed? दो मसल्स को सप्लाई करती है स्पाइनल एक्सेसरी नर्व, राइट? इट सप्लाइज टू मसल्स, एक है स्टर्नोक्लेडोमास्टॉइड एंड दूसरा है ट्रेपेजियस. सो व्हिच मसल इज पैरालाइज्ड? ट्रेपेजियस इज पैरालाइज्ड, ठीक है ना? हाँ, वेरी गुड. सॉरी, आपने आंसर किया, मैंने देखा नहीं. सो अगर यहाँ पे डैमेज होती है तो ट्रेपेजियस इज पैरालाइज्ड. व्हाई? बिकॉज वो स्टर्नोक्लेडोमास्टॉइड को ऑलरेडी सप्लाई किया है. इट ऑलरेडी सप्लाइज द स्टर्नोक्लेडोमास्टॉइड, फिर वो पोस्टीरियर ट्रायंगल में आती है. सो इफ वी कट द नर्व इन द पोस्टीरियर ट्रायंगल ऑफ द नेक, द मसल अफेक्टेड इज ट्रेपेजियस. The person will complain of difficulty in shrugging of shoulders, difficulty in overhead abduction, and there will be a winging of scapula at rest. Fine, perfect. Spinal accessory nerve. Hypoglossal nerve supplies all the muscles of the tongue except palatoglossus. Hypoglossal nerve supplies all the muscles of the tongue except palatoglossus, which is supplied by pharyngeal plexus. Fine. Okay. The porta hepatis of the liver is located between which two lobes? Can you answer this? The porta hepatis of the liver is located between which two lobes? Any guesses? Guess कर सकते हो ये? अब मैं कैसे ड्रॉ करूँ इसको? हाँ चलो, इफ यू कैन आंसर दैट, आप आंसर कर लो, तब तक लेट मी सी इफ आई कैन ड्रॉ द स्लाइड फॉर यू. Yes, any guesses? Hmm. बेर एरिया, ठीक है. अब इसके नीचे चलते हैं. Hmm. ए यार, वन मोमेंट. ओके, दैट्स द लीवर. देखो मैंने पूरा ड्रॉ किया आपके लिए. कैन एनीवन टेल मी नाउ? हाँ चलो बोलो. I've drawn everything for you. If you understood this, ये समझ में आया तो सब कुछ क्लियर हो जाएगा. Fisher for okay. So look at this. ये मैंने आपके लिए ड्रॉ किया है. Just have a look. So ये जो आप देख रहे हो ना, this is the posterior surface of liver. Posterior surface of liver. And इसके नीचे जो है, that's the inferior surface. Inferior surface of liver. So that's the posterior surface and that's the inferior surface of liver. हाँ, तो ये posterior surface है, ये inferior surface है. posterior surface पे क्या क्या impressions है? That's a bare area. That's a groove for IVC. That's a caudate lobe. Caudate lobe के left side पे आता है fissure for ligamentum venosum. Caudate lobe के right side पे आता है IVC. That's the esophageal impression. आप inferior surface देखोगे तो that's the kidney का impression. That's the gallbladder. That's the quadrate lobe. So quadrate lobe के right side पे is the gallbladder. Quadrate lobe के left side पे is the fissure for ligamentum teres. That's the stomach. Between the caudate and the quadrate lobe, this is the porta hepatis. So it's between the caudate and the quadrate lobe. ठीक है. सो बिटवीन द caudate एंड quadrate lobe आता है अपना पोटा हिपैटिस. सो मैंने वो ड्रॉ किया बच्चों. आई हैव ड्रॉन दैट फॉर यू. अंडरस्टूड दिस? सो caudate lobe के राइट साइड पे कौन है? आईवीसी. caudate lobe के लेफ्ट साइड पे fissure for ligamentum venosum. quadrate lobe के राइट साइड पे gall bladder. लेफ्ट साइड पे fissure for ligamentum teres. क्लियर टू ऑल ऑफ यू? Very good. Chalo, great, 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 great. Which artery is primarily related to avascular necrosis associated with the neck of the femur? Chalo, answer this. This is easy. That's easy. Which artery is associated with avascular necrosis? Answer this. So, which is the artery which supplies the neck, head and neck of the femur? Head and neck of the femur. Anyone? Okay, just have a look. Femoral artery gives a branch जिसका नाम है profunda femoris. Profunda femoris gives 3 branches. एक है medial circumflex femoral, एक है lateral circumflex femoral, and एक है perforating branches. So this medial and lateral circumflex femoral gives retinacular branches. Retinacular branches, and this retinacular branches are going to supply the head and neck of femur. But medial and lateral दोनों retinacular branches देते हैं, but the main artery is the medial circumflex femoral artery. So the main artery which gives branches to supply the head and neck of femur is medial circumflex femoral branches. कौन सी branches है वो? retinacular branches of medial circumflex femoral artery. That's a medial circumflex femoral artery. उसकी branches है retinacular branches. किसने आंसर नहीं किया ये? हाँ, so medial circumflex femoral artery. हाँ, very good, very good. A आंसर किया ना बच्चों? A. हाँ, so answer is medial circumflex femoral. हाँ, lateral भी देती है, lateral also gives retinacular branches, but main retinacular branches, a majority of retinacular branches कौन देगा? medial circumflex femoral देगा. So एक select करना है आपको, एक select करना है, so you select it as medial circumflex femoral artery. Deep femoral is profunda femoris है बच्चे. ये जो deep femoral है ना, this is profunda, ये profunda femoris है. Deep femoral किसने आंसर किया है? ये deep femoral अदिति. डीप फीमोरल का नाम है प्रोफंडा, यही है प्रोफंडा फीमोरिस, ये है प्रोफंडा फीमोरिस. प्रोफंडा फीमोरिस की ये ब्रांचेस है. ठीक है, क्लियर है? आर यू अंडरस्टैंडिंग दिस? चलो बच्चों, लास्ट एमसीक्यूज है, लास्ट पार्ट इज देयर. हैव सम एनर्जी, पुट इन सम एनर्जी एंड कम ऑन आंसर दिस, क्रैक दिस एमसीक्यूज. व्हिच आर्टरी इज द मेन सप्लाई टू द स्मॉल इंटेस्टाइन्स? एनीवन? अभी ये आंसर करो. व्हिच इज द मेन आर्टरी सप्लाइंग द स्मॉल इंटेस्टाइन्स? Small intestines belongs to the midgut. Which is the artery of the midgut? Superior mesenteric artery. Superior mesenteric artery is the artery of the midgut. Celiac trunk जो है, it's the artery of foregut. Celiac trunk is the artery of foregut. Celiac trunk is the artery of foregut. Superior mesentery is the artery of midgut. Inferior mesenteric is the artery of hindgut. Fine. So what are the branches of superior mesenteric? बोल सकते हो branches of superior mesenteric artery. One is inferior pancreaticoduodenal, inferior pancreaticoduodenal artery. Second is jejunal and ileal branches, jejunal and ileal branches. तीसरा है middle colic, middle colic. चौथा है right colic. पांचवा है इलियोकोलिक, पांचवा है इलियोकोलिक. इलियोकोलिक के दो ब्रांचेस होते हैं, असेंडिंग एंड डिसेंडिंग ब्रांच. डिसेंडिंग ब्रांच के चार ब्रांचेस हैं, एंटीरियर सीकल, posterior cecal, appendicular and ileal. So very important here is appendicular artery is a branch of what? So appendicular artery is a branch of descending branch of ileocolic, superior mesenteric. Appendicular artery is a branch of high swernim. Very good, बढ़िया है, समझ में आ रहे हैं सब. It's a quick revision. Very good. It's a quick revision for you. Great. Universities are abhi universities. Okay. So what are the branches of superior mesenteric artery? One, the inferior pancreaticoduodenal, the jejunal and ileal branches. So who supplies the small intestines? The jejunal and ileal branches of superior mesenteric artery. मिडिल कोलिक, राइट कोलिक, इलियोकोलिक. इलियोकोलिक के असेंडिंग डिसेंडिंग ब्रांच, डिसेंडिंग ब्रांच के चार ब्रांचेस हैं, एंटीरियर सिकल, पोस्टीरियर सिकल, एपेंडिकुलर एंड इलियल. बच्चों एमसीक्यू आता है, एपेंडिकुलर आर्टरी इज अ ब्रांच ऑफ, योर आंसर इज द डिसेंडिंग ब्रांच ऑफ इलियोकोलिक. ठीक है. इंफीरियर मेसेंट्रिक के तीन ही ब्रांचेस है, वन इज लेफ्ट कोलिक, स्टिग्मॉइड ब्रांचेस, लेफ्ट कोलिक, सिग्मॉइड branches and superior rectal artery, superior rectal artery. So superior rectal artery is a continuation of inferior mesenteric. Inferior mesenteric की continuation है. So it's a quick revision है ना, स्वर्णिम, स्वर्णिम. Okay, fine, clear है बच्चों? It's fine. Yes, Aditi, clear बच्चे? श्वेता, it's Raval. Yes, explore the cinema. Fine, great. After a fall, the patient presented with a deformity as shown in the image. Which of the following is damaged? What is this? ये क्या है? What is this condition? Wrist drop. Wrist drop. And wrist drop is due to injury to the radial nerve muscle है, extensor carpi radialis longus. Easy. ये इजी है ना निखिल? अदिति बोलो, आंसर करो फटाफट फटाफट. यस. So that's a wrist drop. This is a fracture of the mid shaft of the humerus. Mid shaft fracture होता है. Mid shaft fracture होता है तो radial nerve होती है spiral groove में. The radial nerve is injured in the spiral groove. Medial नहीं है बच्चे, medial नहीं है. That's a wrist drop. This is wrist drop. The nerve is radial nerve. Shiva, that's a wrist drop. The muscle responsible for this is extensor carpi radialis longus. Extensor carpi radialis longus. ठीक है? Perfect, perfect, perfect. बाकी सब nerves आपको पता है. Actually, you know and all you know. As shown in the area, can lead to fracture of which bone? What is this? What is this area? That's the anatomical snuff box. Anatomical snuff box. अब how is the anatomical snuff box formed? देखिए, that's the head of the radius, neck of the radius. That's the shaft of the radius. That's the radial tuberosity. That's the ulna. That's the ulnar tuberosity. एक मसल है which begins from the radius and ulna, abductor pollicis longus. एक मसल है which begins from the radius, extensor pollicis brevis. Abductor pollicis longus, extensor pollicis brevis, they come together. This is the extensor pollicis longus. It goes single. ये बन गया anatomical snuff box. The floor of the snuff box is formed by, this is the styloid process. Styloid process, scaphoid and trapezium. Trapezium. Okay, so styloid process, scaphoid and trapezium. That forms the floor. Floor के ऊपर, ये bones के ऊपर दो tendons होता है. Tendons of ECRL and ECRB. These are the two tendons. Fine. Clear. So that's a snuff box. So which is a bone which is very commonly fractured? The scaphoid. Scaphoid fracture होता है, avascular necrosis होता है scaphoid का. हाँ, avascular necrosis. ठीक है. So which is the lateral boundary of the snuff box? Abductor pollicis longus, extensor pollicis brevis forms the lateral boundary. Extensor pollicis longus forms the medial boundary. The floor is formed by the styloid process, the scaphoid and the trapezium. These two tendons are lying on the bones, so they also form the floor. ECRL, ECRB, they lie in the floor. Content is radial artery and roof में होता है cephalic vein and the superficial branch of radial nerve. Cephalic vein and the superficial branch of radial nerve, that's in the roof of the snuff box. Cephalic vein and superficial branch of radial nerve, that's in the roof of the snuff box. Fine, so that's scaphoid. Coming to the last 5 MCQs, students, last 5 MCQs of the set. Come on, have energy and answer. Which muscle forms the floor of the mouth? फ्लोर ऑफ द माउथ मतलब ओरल डायफ्राम. ओरल डायफ्राम कौन बनाता है? ये ओरल डायफ्राम बोल सकते हो. ओरल डायफ्राम इज फॉर्म्ड बाय माइलोहायोइड. फ्लोर ऑफ द माउथ इज ओरल डायफ्राम. इसका दूसरा नाम है ओरल डायफ्राम. ओरल डायफ्राम इज माइलोहायोइड. यू टेल मी पेल्विक डायफ्राम. Pelvic diaphragm is formed by whom? That's the levator ani. Levator ani. Okay. Levator ani forms the pelvic diaphragm. Geniohyoid नहीं है बच्चे. Geniohyoid नहीं है. Subha, it's not geniohyoid. Nikhil, it's not digastric. Floor of the mouth is the oral diaphragm and the floor of the mouth is formed by mylohyoid muscle. Mylohyoid is known as the oral diaphragm. Pelvic diaphragm is the levator ani. Then the cervicothoracic diaphragm. Cervicothoracic diaphragm is Simpson's fascia. ये जो suprapleural membrane है, मतलब ये oral diaphragm is mylohyoid. Separates the mouth from the neck. The neck from the thorax is separated by Simpson's fascia. That's cervicothoracic diaphragm. Thorax is separated from the abdomen by our normal thoraco-abdominal diaphragm. The pelvis is separated from the perineum by pelvic diaphragm. That's the levator ani. Pelvic diaphragm होता है levator ani. Fine. Cephalic है बच्चे. Cephalic, स्वर्णिम. Cephalic vein है. कैथेटर डालने के लिए cephalic vein है. Fine. So identify the muscles given in the image. Yes, muscles given in the image. Anyone? What is this muscle? एक मिनट, I'll just start with this. What is this muscle? ये कौन है? psoas major. ये कौन है? quadratus lumborum. And what's this? Transverse abdominis. The psoas major, quadratus lumborum, transverse abdominis. And ये छोटा सा मसल देख रहे हो on the psoas major, that's a psoas minor. ये this big muscle is psoas major. psoas major के ऊपर ये जो मसल दिख रहा है that's psoas minor. कैथेटर डालने का है कि आईवी डालना? आईवी जब डालते हैं तो मीडियन क्यूबाइटल वेन में डालते हैं, कैथेटर डालते तो सिफेलिक वेन में डालते। सम से बेसिलिक वेन में डालते बिकॉज बेसिलिक वेन इज अ डायरेक्ट कंटिन्यूशन ऑफ द एक्सिलरी, दैट इज आल्सो फाइन, बट जनरली वी प्रेफर सिफेलिक। ठीक है, सो नाउ टेल मी व्हाट इज द सीक्वेंस। ए कौन है? A is psoas major, A is psoas major, B is psoas minor, C is A psoas major, B psoas minor, A psoas major, B psoas minor. Answer is yeah, B. A is psoas major, B psoas minor, C is quadratus lumborum. Sorry, A is psoas major, B psoas minor, C is quadratus lumborum, and D is transverse abdominis. So answer is A for this. A है आंसर, A. फाइन है बच्चे। सो ये जो बड़ा मसल है वो psoas मेजर है, उसके ऊपर जो छोटा सा द स्मॉल मसल है psoas minor, दिस इज quadratus lumborum, दिस इज transverse abdominis. So this muscles are going to form the posterior abdominal wall. इस पे होता है posterior, this muscles forms the posterior abdominal wall. ठीक है, fine. General sensations from the anterior 2/3 of the tongue is carried by which nerve? चलो ये हमने डिस्कस किया है ऑलरेडी. Answer this. General sensations from the anterior 2/3 of the tongue is carried by A is not so. ये आंसर is A for this. हाँ, इसका आंसर A है. General sensations from the anterior 2/3 of the tongue is carried by whom? Yes, lingual nerve. ये पता है ना आपको? This you know, no? So anterior 2/3, posterior 1/3, and the posterior most part. Posterior most part. This is general sensation. This is special sensation. Anterior 2/3 general sensation is lingual. Special sensation is chorda tympani. Chorda tympani. Posterior 1/3 is glossopharyngeal nerve. Posterior most part is internal laryngeal nerve. Internal laryngeal nerve. It's a branch of vagus. D किसने लिखा आंसर? D नहीं है बच्चे आंसर. Explore the cinema. General sensations. What is the hypoglossal nerve supplying? Hypoglossal nerve is motor to the tongue. It supplies the muscles of the tongue. Hypoglossal nerve supplies the muscles of the tongue. It is motor. यहाँ पे क्या पूछा है? Sensations. General sensations, anterior 2/3 is carried by lingual nerve. Special sensations, that's taste, is carried by chorda tympani. Posterior 1/3 glossopharyngeal nerve. Posterior most part is the internal laryngeal branch of vagus. That's a branch of vagus. ठीक है? क्लियर है बच्चों? ये हेलो बच्चों, आर यू एबल टू फॉलो? कम ऑन कम ऑन कम ऑन, लास्ट एमसीक्यूज आर लेफ्ट. हैव पुट इन सम एनर्जी, हैव सम. एग्जाम्स हैज कम क्लोज. फाइन. आंसर दिस. व्हिच लिगामेंट इज इंजर्ड? ये कौन सा लिगामेंट है? बोल सकते हो? ये कौन सा लिगामेंट है जो एंटीरियर एस्पेक्ट से शुरू होकर पीछे जा रहा है? इट बिगिंस फ्रॉम एंटीरियर पार्ट ऑफ द टिबिया एंड गोज बिहाइंड. And there's one ligament which goes from behind and comes forward. So what is this ligament? These two ligaments are intracapsular but extrasynovial. Intracapsular but extrasynovial. ये है, the one which is injured is ACL, anterior cruciate ligament, or that is PCL. ACL begins from the anterior aspect of tibia and ये पीछे की तरफ जाता है. That's ACL. ACL prevents the anterior displacement of tibia on the femur. ACL prevents, PCL नहीं है बच्चे, ये ACL है बच्चे, ACL है. You're looking from front, सामने से देख रहे हो बच्चे. You're looking from front. This is ACL, anterior cruciate ligament है. ये आगे से शुरू होता है and ये पीछे की तरफ जा रहा है, and पीछे से आगे की तरफ आ रहा है. That is PCL. Anterior cruciate ligament prevents the anterior displacement of tibia on the femur. Okay, if the ACL is damaged, what is that sign known as? Anterior drawer sign. Anterior drawer sign, right? And this ACL becomes taut, tensed in extension. ACL becomes tensed in extension. PCL क्या करता है? PCL prevents the posterior displacement of tibia, and the PCL becomes tensed in flexion. Flexion. ये दोनों cruciate ligaments are intracapsular and extrasynovial. Intracapsular and extrasynovial. ठीक है? ACL prevents the anterior displacement of tibia on the femur. उसको बोलता है anterior drawer sign. Anterior drawer sign अगर वो इंजर होता है तो during esophagoscopy of foreign body removal, which of the following constrictions are not clinically relevant? बोल सकते हो? हाँ, very good बच्चे, very good. So, what are the constrictions of esophagus? At C6, what is that? Pharyngoesophageal junction. Pharyngoesophageal junction. T4 is arch of the aorta. T6 is the left bronchus. And T10 is diaphragm. Entry into the diaphragm. So these are the constrictions of esophagus. C6 is the pharyngoesophageal junction जहां पे वो शुरू होता है. T4 is the crossing of the arch of aorta. T6 is the crossing of the left bronchus. And T10 is where it enters the diaphragm. अब इसका आंसर क्या होगा? So what is the answer for this? हाँ, आंसर ए कैसे होगा बच्चे? ए कैसे होगा? क्रिकोफैरिंक्सिस pharyngoesophageal junction. Cricopharynx pharyngoesophageal junction. Cricopharynx pharyngoesophageal junction. Answer is ये C. Answer is C for this. देखो ना बच्चों, just try to see the options properly. आप बहुत close होगा. Right bronchus का तो सवाल ही नहीं है ना. Right bronchus का सवाल ही नहीं है. Right bronchus doesn't obstruct the esophagus. It's the left bronchus. It's the left bronchus बच्चे. Cricopharynx pharyngoesophageal junction. That is C6. Cricopharynx pharyngoesophageal junction. That is C6. Cricopharynx का level is C6. C6 है वो. Pharyngoesophageal junction. That's C6. Okay. Is this clear बच्चा? क्रिकोफैरिंग्स पता है ना आपको? फैरिंग्स का जो लास्ट मसल है ना, क्रिकोफैरिंजस पार्ट ऑफ द इंफीरियर कंस्ट्रिक्टर. क्रिकोफैरिंग्स के बाद ही वो बनता है इसोफैगस. सो फैरिंगो इसोफेजियल जंक्शन, और यू से इट एज क्रिकोफैरिंग्स. दैट्स द सेम. समझ बच्चों, ऑप्शंस ठीक से देखना. ऑलवेज सी द ऑप्शंस प्रॉपरली, है ना? सो आंसर इज सी फॉर दिस. आंसर इज सी फॉर दिस. क्लियर है? Oh wow, that's the end of the session, बच्चों. Thank you so much. I hope these things are clear to all of you, बच्चों. Important topics की list मैंने दी है आपको. Just read, go through those important topics. Keep on revising, keep on revising, keep on revising. Solve MCQs, solve the previous PYQs. Important topics को revise करिए, and then you will definitely crack the exam. आप definitely crack करोगे. बच्चों, the way you are answering, the way you are interacting was really good. That was excellent. And just continue in the same tempo, in the same speed. And yes, you will definitely succeed in the exam. And on the day of the exam, be fresh. Have a good sleep, be fresh, and try to recollect everything that you have studied in the lecture or by yourself. Anna. So don't be tensed, bachon. Don't be tensed. Don't be tensed. वो है ना, PW के चैनल पे दिया है. हाँ, लिस्ट ऑफ इम्पोर्टेंट टॉपिक्स है वो. बट एवरीथिंग आई हैव कवर्ड हियर. एवरीथिंग आई हैव कवर्ड. एक कॉम्पोजिट मसल बोल सकते हो. एक जाते जाते कॉम्पोजिट मसल बोल सकते हो. व्हाट इज कॉम्पोजिट मसल? जाते जाते एक 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 एमसीक्यू. व्हाट इज अ कॉम्पोजिट मसल? जिसके दो नर्व सप्लाई होते हैं. अ मसल व्हिच इज सप्लाइड बाय टू नर्व्स इज नोन एज अ कॉम्पोजिट मसल. नाउ नेम द कॉम्पोजिट मसल. नेम द कॉम्पोजिट मसल. एनीवन? क्लिनिकल रिलेटेड एमसीक्यू, यू कैन सी माय यूट्यूब चैनल, मेरा यूट्यूब चैनल है एनाटॉमी अनलिमिटेड. हाँ, फॉर क्लिनिकल एमसीक्यूज स्वर्णिम जस्ट रिफर टू दैट एनाटॉमी अनलिमिटेड. मैंने सारे क्लिनिकल एक्सप्लेन क्लिनिकल क्वेश्चंस दिए उसमें. ठीक है. ओके, दैट्स फाइन स्वर्णिम. ओके. Okay, just tell me which are the list of composite muscles. Number one, start in the upper limb. Pectoralis major, pectoralis minor, supplied by the medial and lateral pectoral nerves. One composite. Second is brachialis. The nerve supplies radial nerve and musculocutaneous nerve. तीसरा muscle is flexor digitorum profundus. That's a dual nerve supply. And flexor pollicis brevis. So चार मसल्स हैं जिसके ड्यूअल नर्व सप्लाई है, हाइब्रिड मसल्स है. पेक्टोरलिस मेजर, पेक्टोरलिस माइनर, ब्रेकियालिस, फ्लेक्सर डिजिटम प्रोफंडस, फ्लेक्सर पॉलिसिस लॉन्गस. लोअर लिम्ब में नंबर वन पेक्टिनियस, दैट्स अ कंपोजिट मसल. एडेक्टम मैग्नस and the biceps femoris. Excellent. Adductor magnus, biceps femoris, pectineus. These are the composite muscles in the lower limb. नीट पीजी के लिए निखिल स्टार्ट सॉल्विंग द एमसीक्यूज सॉल्व करो. जितना एमसीक्यूज सॉल्व करोगे उतना इट विल बी इजी फॉर यू. I hope बच्चों this lecture is clear and this lecture was beneficial, helpful to all of you. In case of doubts, yes, do get back to me. Thank you so much, my dear children, for your patient listening, and all the very best from me and the entire team of PW for your exams. Have patience, be confident, you'll succeed. Thank you. Bye-bye. I'll stop. कुछ doubts है? First prof students you can study. There's no problem. Important questions कर लेना. ठीक है? I hope things are clear to all of you. कुछ भी doubt है तो just get back to me. Okay. Bye bye. I'll stop here. Thank you. Bye bye.